Thank you and welcome to the online NPTEL learners. Today we'll be conducting this online session, which will be the last session before your exams. I have divided this session in 4 parts. We'll be taking for today's discussion 2 segments broadly. One will be JCI and the other would be ISO. These are the 2 important accreditation that we will discuss today. We'll be discussing about the subcomponent of taking an practical example of JCI as a part of a case study and even an ISO. So we'll take it in 2 sessions, 2 to 4 and 4 to 6. Okay. We'll talk about the differentiations, what is the requirement, implementation, and what are the different changes that we see as an organization or healthcare institution when it seeks for a JCI or even ISO as a culture. Okay, so let me begin with placing you how we see healthcare, particularly now in the coming time. And when we talk about today's healthcare environment, where delivering a high quality care is one a need, but it is not just being seen as a goal, but as I spelled that it's a need, it is coming like a more a necessity, an urge from the healthcare receivers, or I mean to say customers or patient. So hospital as such across the globe or India. So in context to JCA, we'll be talking about more global challenges for healthcare and hospital and how constantly hospitals are emerging themselves and working on improving, especially the standards and the practices. So when we do all this improvement in standards, taking up ahead the clinical processes, also the operational challenges, the different practices that hospitals are taking, there needs to have a set of a quality delivery of the health services. And along with that, we have patient safety as a very important aspect, which is coming with the coming times. There is also an urgent need of increasing clinical excellence, which spells to be more important when we talk about JCI. And no doubt, as an hospital administration point of view, and even taking healthcare management in core, we need to also think about operational efficiency. So these all 4 things as an element lie into the base of JCI. Okay. JCI accreditation standards for hospital makes us more clear that this Joint Commission International, which seems to be setting up standards to hospitals, even Indian hospitals are also there. We'll be discussing about those hospitals. And when the Joint Commission International sets this to take ahead as a challenge or to take ahead as a responsibility at the primary level, I may say responsibility, and then next level it becomes a challenge if the hospital or the hospital is not able to take the culture as. And when these services of the hospitals or healthcare institutions which are offered, they take a benchmark of quality and safety. Okay, so quality and safety becomes the core thing. Okay, no doubt actually. I think students, we will put this at the last, the explanation. We will go. I just want that in the revision session, when we will be focusing more for the part that will be very important for you to go through your studies, exams. So I'm making an effort actually to get it covered actually, that in the previous, when we started with NQAS, NABH, now JCA and ISO, the 4 important accreditation, I want to brush it up for you. That's the reason we have organized this. So JCI accreditation standards for hospitals are one which are set for internationally recognized guidelines actually, which sets to make the organization not only internationally recognized but also to develop those organizations in terms of ensuring some level of importance that these institutions give quality. So I'm putting one away actually that there is also a need of quality even though when the institutions have already started setting themselves, or even those institutions who have already received JCI. So it is not being stating that if you are a JCI, you will completely deliver a set of an healthcare delivery which is 100% up to the mark for quality. You need to work on it continuously. That's how we go to the final level of philosophy of ISO, which already in my sessions I've already covered. But here I would just want to give you more practical insights, which makes you more important to understand why this is more efficiently being taken as a guidelines. So JCI usually work on a recognized guidelines which are developed by ensurement of consistent and safe healthcare delivery. There is also an effectiveness which is being spelled into the philosophy of JCI, which is many times needs to take lot of efforts. Okay. So you need to work according to the guidelines, that's for sure. And these standards which are there in JCI, they need to be covered with all aspects of the hospital operations. Nothing is left to be seen that it is to be ignored or it is to be sidelined. The major focus lies on the patient care. Second, it comes in align with the facility management, which is already very important for any accreditation. Medication safety, which makes the hospital more clear in terms of infection control practices and patient safety. And no doubt it works more on the staff's qualification, all healthcare workers, healthcare professionals, each and everyone. Additionally, which is being very important and globally, which is being seen with respect to patient and patient safety concern, patient rights is one important element. So JCI accreditation standards work to cover all this. And these standards are capable enough to demonstrate the commitment that the global best practices which are seeking continuous improvement. We never say that it is completely assured. Okay, that part is one which the institution at the level has to take, neither not the JCI. JCI has to accredit. JCI has to evaluate. So JCI evaluates hospital which are based on measurable elements. Okay. When we talked about the aspects, we are talking now on elements, and these elements ensure that the policies that the hospital has prepared are not just documented, but they are effectively implemented. So documentation is the one part that is very, very important for those who have started their journey in healthcare quality. They need to put that in mind that documentation is not only working in quality. Documentation is no doubt one to prove what you have done and to state that how quality will be continued. But it is very important that effectively implementation or effective implementation, as we have even studied in NQAS, also in JCI, also in NABH, which gives more importance on documentation. But here, effective implementation is equally and far more important compared to the documentation. So this approach makes quality a consistent part and the delivery to every patient at every time. So as if like the definition of quality gets completely covered over here. The focus areas of JCI standards which covers are primarily in two categories. Where we find the patient-centered approach is one, and second is the organization management standards. So we have patient-centered standards and the other are healthcare organization management standards, or you can say hospital management standards or healthcare organization management standards. And the very first is the patient-centered standards. Patient-centered standards become very important to institutions who have really not come up to those uh, aspects where the patient centeredness is a need and not to be seen as a neglect. So patient centered standards address the critical aspect to make sure that the access to the healthcare or the assessment, it can be as from your emergency department or even a part of your surgery department, as putting up the patient under the anesthesia or even taking ahead the surgical care, obstetric care, gynec care, pediatric care, the medication management, the patient education, the healthcare communication, the discharge of the patient. These all standards of patient-centered care ensure that the patient who comes to your hospital or your healthcare institution, they receive timely care. They get a respectful care. And also, along with this, a safe care where they are ensured that throughout their journey, throughout their stay in the hospital, they benefit with all these things. One is very important thing, that is timely care. Second is like they received a respectful care, that is dignity as a part. And the third and very important is the safety. So you may ask whether it works on equity. Definitely it doesn't work. That is, equity aspect is covered in NQAS. Here the equity aspect is not covered. Here it is more of the three part in patient-centered standard that is covered. No doubt the fair treatment with respect to what you have paid or what the services that you are really trying to get through the charges that you have made, that is ensured. No doubt that is also one a part which is covered in the organizational management. Okay. Now the second category is of healthcare organization management standard, HCOM, or hospital management standard, HMS. Hospital management standard or healthcare organization management standards covers the leadership part, that is the healthcare leadership, also covers the staff's qualification, it covers the patient safety, it covers a component of patient safety in the hospital safety, that is the facility safety or department safety, we can say. And very important for the gathering here, the infection control part is also covered under here, the quality improvement, and even the clinical governance. In the larger governance aspect, we see to cover this. These all guidelines ensure that the hospital functions are well organized and they are focused to meet the level of excellence. So one is like a management, the other is like a patient. So when we talk about this, the management aspect covers the categories which makes it there are two quality, and the patient focus is more a sublime to it, which is giving it more benefits actually, that gives the hospital a status which comes to as a comprehensive model. Okay, so hospitals by JCI are being seen to see a comprehensive model of health service delivery, which are being seen more benefiting to access part and upgrading the services in continuity. So the accessing of the healthcare services, when it is stated into those institutions are available, you will get an upgradation day by day. Whenever you see an organization which is stating that they are JCI accredited, they are continually seeing an improvement. And that becomes very important for institutions which are making efforts that JCI comes to their institution, and the institutions need to be called up as an institution of excellence towards health services. So JCI accreditation standards for hospital will be now our focus of discussion. These hospitals who try to seek JCI are a baggage of excellence, and they work on healthcare excellence to achieve this and to keep it always in aligned to the patient needs. Primarily speaking, patient needs are more coming not when the patient really put it is more from the patient education, that educated patient with paying capacity or from urban setups, they put more reasons for patients needs and demand. But patient safety is something which is required for every sort of patient's need. So that should not be ignored. The quality outcomes becomes something as a larger umbrella to cover patient safety beneath it. So when the credibility, the hospital will try to get an image creation after getting the JCI, it will be particularly more being seen for those patients who are coming either from an educated class groups like an literacy or like a paying capacity. And third is like patients who are coming from na, medical tourism, especially foreign patients. So these are one way we can put it as a clientele that how JCI is being important. So JCI accredited hospital tend to have enhanced themselves, or they are the institutions are prepared actually for operational efficiency. Like their operational efficiency is something actually they have to work, and the quality management team actually, the healthcare quality management team in those institutions actually need to see that operational efficiency is something which gives them the major benefit. Okay, they work on reducing the medication error. Na? They work on seeking that the institution is far enhanced actually for the clinical performance. So clinical performance will somewhere or the other give more benefits to the institution to get more reasons that the institution's claim for JCI accreditation becomes very perfect. For this particular part, you require no doubt a good HR, your talented employees, na? All those who have being stated as a part that they are one who are responsible for taking this as a responsibility. And when your healthcare workers are inclined actually towards working and making your institution something which is coming to the global standard, they are somewhere or the other learning JCI and they are practicing the excellence of quality. This should be something coming as an equation. Okay. So when I'm saying they are learning and then they are practicing excellence actually is something like that, you need to first develop a culture for taking this JCI as a team efforts, making your healthcare workers work hard and make the institutions not to be seen only as JCI accreditation, but the entire process from learning to transforming an employee towards practicing is something just making a shift from the pre to post complete change. The process of accreditation of JCI involves several segments, stages, I mean to say. The very first, like every accreditation require is something like that self-assessment or internal assessment or internal quality teams assessment or taking as a root cause actually why and in what way the institution is getting quality issues, or the institution already has some level of accreditation taken at a local body or a national body, but not from an international body. And those organizations can also go. But yes, again, by the self-assessment for JCI preparation. Next comes the gap analysis. What is done previously, what is done to be done now, and what is to be done in next course of time. How much time you will require, that is called as gap analysis. Who all will be one involved, what is the previous team, what is the current team, and who will be the next line in leadership to take this. That is gap analysis. The policy development with respect to how this institution has developed and over the period of time the institution will take ahead, and what are the expansion plan if there is something which is to be scale up in terms of the healthcare facility and all those. So the policy development, which is one which starts from training, which comes on from feasibility, which comes from staffing actually, or if there is a lack and all that, and then make it more rigorous in terms of developing a training culture. So this is something called as accreditation process. It looks to be simple, but when we work on JCI, it is something like you are discovering the areas where there is non-compliance or poor compliance, and the institute should work on giving the corrective measures. The corrective measures are something which makes the institutions who are coming for JCI a preparatory phase and a completion phase. Preparatory phase is something when you are trying to make really the gap analysis work. You work on the gap. You work upon those places. I said no, that where there you find a poor compliance or non-compliance with respect to the patient's benefiting aspects, JCI will carry all this through out the process of JCI accreditation, and they will compile and they will see that the standards which the JCI accreditation process is expected to complete, they will work on, and it will be a continuous monitoring followed by again a recycle if it is required a reaccreditation. Reaccreditation, if the part is not complete, and when you get an accreditation, you maintain it. You maintain it in terms of performance of the standards actually, that you find that they are to be everly improved. So JCI accreditation contains all of the inclusiveness as a guide actually when we try to think about institutions who really take this and they are able to provide this. Institutions who are not able to come up with the requirements or the requirements in their mid phase or in their phase where they are really not prepared, they come up to state that this becomes a topic for them, that the patients who they have made as an beneficiaries, or they find that the entire uh, circle actually should revolve around the patient. So there are international patient safety goals that are very important over there. And they are the one which are very, very important in terms of the most critical and foundational goals that are to be achieved. As I stated, errors are something actually which we always discuss in quality, and errors becomes very important actually in terms of reduction. It is not that errors are not expected or they are inevitable or they are very unprecedented actually, but it is very important that when we try to work on errors, especially for patient safety related, which comes from the different angles actually, identification of the patients correctly becomes very, very widely important when you find that institutions who are with JCI, they never face with identification markers. And at least two identifiers are something which you will find that institutions, particularly JCI, they make it very clear. You will find among the employees very effective communication, very standard way of dealing, whether it is a protocol from your verbal communication, non-verbal communication, telephonic orders, whether they are doing your critical test, everything, every sort of 4, 5, 6 levels of communication, which usually in healthcare workers need to practice, though all, even paralanguages and all that, they are very, very effectively able to communicate. So this is very important because they are trying actually to meet themselves or to work on the international patient safety goal, IPSG. IPSGs are always one which keeps you more also to think that your patient safety is a priority. So there is a high alert medications. So when you're working, either a pharmacist, either a nurse or a doctor or even a dispenser, whoever may be, they need to work more on the look-alike, sound-alike drug. While writing or while reading or while putting the notes, if your drugs, you find that they look in terms of their spelling or their names actually, which gives major chances of errors, or sometimes when they are dispensed or when they even are placed, or in terms of their names, or sometimes even when they are administered, whether it is an IV or IM, look-alike, sound-alike drugs are something which is very, very important in terms of the safety alerts, which is very, very important. It is not that constantly institutions are putting signages or institutions are giving them training, but if you are not practicing it and you are not able to monitoring it actually to reduce the incidents, or even making the employees more responsible actually to be very morally and ethically meeting this, The high alert is only an high alert without any practice. The very important part again with respect to international patient safety goal that comes is like improving the practice of ensuring a correct site, whether it is an operation, whether it is an injection, whether it is an infusion, whether it is a marking, or everything. It is more a process driven part that your process should be very, very accurate. So correct site, correct procedure, correct patient. Now, correct patient, correct site, correct procedure. This is the formula. And then only you will get a correct surgery. So what is that? It is timeout procedures where you work more on first identifying who is your patient, what is the disease condition, checking it again with all the checklist, making a correct site, do a correct procedure, and then you find that the patient will get a maximum level of benefit with respect to this timeout phenomena that we will be taking for JCM. Okay. Then comes in this same patient, international patient safety goal, which I want to add only a few things, which will not go in detail because I will be covering this part and then we'll go for the case study. Reducing the healthcare associated infection. No? Without talking about hospital acquired infection or healthcare associated infection, JCI will not be achieved. Just like all other quality standards, you need to very importantly seek one culture that is very important, that is adherence to the hand hygiene guidelines. No? Adherence to the hand hygiene guidelines will reduce maximum load of the institutions who are struggling with healthcare associated infection. You will find the risk of patient harm falls down like anything. Your risk assessment, your challenges to mitigate the risk actually will be dropping like anything. And your institution will be one who are achieving the maximum international patient safety, the goals. Now we will see the patient centered standards, how they are being worked upon and how direct care is being instituted for those. When we talk about access to care and continuity of care, so there are two parts. One first C is the care, that is the care delivery that it is expected for every patient, and the patient sorry comes to the institution for this part and continuity of that care, whether it is a follow-up, whether it is a readmission, whether it is a transfer, or you mean to say whether it is a chronic patient who comes only for the acute exacerbation of those conditions. So the access to care and continuity of care, these two things are coming as an ACC. So what ACC will see screening, examination, admission, readmission, transfer, and all those protocols aligned to all these things. So do they need to prepare protocols? Yes. Do they need to see that these protocols are followed properly? Yes. And they need to see that the healthcare workers are something very, very serious about this. Okay. Then comes the patients and family rights. Patients' rights are again being seen as a privacy, anonymity, confidentiality, informed consent, ethical care. Okay, are becoming very, very important that patient and family rights. Patient along with patient's family. Patient now comes very important when you find that the standards which are developing or which are developed in the initial phases or have gone through, suppose like an institution is going for some months or years of the JCA part and they are ongoing for this assessment, they need to meet up those. The care for the patients, particularly who are coming with special needs, suppose a patient who is a cancer patient and along with that the patient develops some acute viral infection, or a patient is something um, a diabetic patient has come with a load of an acute typhoid. So the care of the patient becomes very important of evidence-based care because there is a comorbidity that is lying along, and there are sometimes patients who require even surgery, anesthesia, surgical care. Now, too much of additional cares or single level specialty care is also important. So evidence-based care is something which gives more reasons that a care of the patient, particularly in JCA institutions, gives more value for. Now comes, even in NABH also we have studied this, that is medication management. And here also medication management comes with a little larger element, that is addition, which is compared to NABH, I can say. That is the procurement, storage and prescribing. These are the three protocols every institutions usually follow. What makes it more over here that the management is more being skilled, is being seen with respect to the skills of procurement, timing, ranges, storages, capacity, quality of storage, ensuring the safety, prescribing protocols, errors to be made, practices, training. So it goes on little detailing about how this medication management and the use of that medication becomes very important for the healthcare institution to take it serious. Okay. Before completing the patient safety standard, patient center standard, one addition that JCI has little an edge and which makes JCI something very important is like patient and family education. Nowadays, it has become very important. Health education, health communication, the same way patient and family education plays important role over here. And all health education, health communication theories which binds up to give this accreditation process more intention on teaching the patient about their care. The patient need to be taught how their care should be taken, how their medication should be kept, how they should ensure that their safety is to be very important, how they are taking responsibility of their own care along with the healthcare workers. So with this makes more broader to us before we go into the deep of the patient centered. Now, the healthcare organization management standard or hospital management standard, just giving you detail in 5-10 minutes, like how this is. The institutions who run safely and are efficiently planning actually to see that although otherwise they are working on this part, but it is not stated because patients who are more from international needs, patients who are coming foreign clienteles, either for surgery and all that or medical tourism, they always see hospital as a choice only of quality improvement. Now they will be going with lot of search. They will have pool of agencies. They will also try to come up with any wrong incident in hospitals, whether they are forced. So they are coming with a deep preparation actually for that, where their consultants are also putting them that these are the institutions that you need to see when you are going for this. So quality improvement and patient safety for healthcare organizations in this particular standards become more a data driven improvement, that whatever you are showing as an improvement should have some set of an data. Your healthcare analytics actually will show that whatever measurement that you are trying to make for your success, it is more outcome driven, which is stating that you have started with this, you are putting this. So operational part will not be fulfilled without putting an evidence for that. Incident reporting is something which is playing more important, that without any incident reporting, how come the organization has drastically improved over the period of time? That will be a big question by your internal assessor and even external. Internal assessor should ask, then and then you will be able to understand what the previous report is being done. Okay. So quality improvement and patient safety, which is again a part of the previous patient safety, patient oriented standard, patient centered standard. Prevention and control of infection, very important topic for you, that the sterilization process, disinfection process, surveillance, infection control program, in prevention program, all hand hygiene, training, needle stick injury, everything which is making more containment of the infection, preventing the institutions from infection, reducing the load of superbugs and all that, which gives us more a reason that institutions who are working with this are something which goes more a part of detailing actually that institutions are working with the players, especially the quality managers, in making the efforts of prevention and control more effective. No doubt for every institution, as I already stated, that clinical governance, leadership, and COs, MS, they are also very important people actually, because they are one who will give you or lead you for this task of healthcare quality. Because we are discussing more healthcare quality detailing of JCI, which comes from the benefits of accountability and credentiality of the institutional heads, which makes this journey of your very, very effective. Okay, because sustainability is something which is supported by the institutional top head. Ethical management is something which is done by the top head. Directions for meeting the yearly load of healthcare quality management is done by the top head. So you cannot ignore actually the part and just see that because the institutions are needing it, and but the organization at top head are not really supporting, the efforts will be little failure. Okay. Now coming to the larger and the broader fragment of giving you the foundation for all this is the facility management in terms of safety, or facility safety also you can say, whether it is a fire safety, hazardous material, yeah, storage of the hazardous material, medical equipments, disinfection and sterilization of the medical equipments, maintenance of the medical equipments. Okay, whether it is a quarterly plan, or a 6 monthly or yearly maintenance plan, that is also very important. Staff qualification. The staff qualification comes a very important component of management, especially for hiring, na, uh, them, selection, training, orientation of the staff, evaluating the competence, making them work, in-house training. Whether it is a staff qualification or staff education, paves more importance in development of JCI accreditation process. Very important part, which many times quality as such, when a journey starts and when quality was being in the evolving phase, the confidentiality, integrity or ethics part of the quality was not being seen in that much development, because quality in healthcare took more lessons from aviation industry. No doubt, manufacturing industry was the first part to make and see that how these institutions are giving more reasons that security of the patient becomes very important, when quality in healthcare took major lessons of security for aviation industry. And there becomes very important that the information that is coming for safety part needs to be compiled, worked on, evaluated and implemented in terms of reducing those. Okay. So before we see the case and we'll go for the analysis for that, I can state that the gold seal actually that people usually love to get for JCI, that doesn't comes only because the institution is expecting, or the few group of people. The entire hospital employee needs to work and see that the institution take self-assessment or gap analysis, identifying and working on the non-compliant areas or non-compliance areas. The policy development and documentation that the institution is putting for JCI, they are writing the proposal, they are working on that part, they are going for the internal team, implementing the compliance, developing the standard operating procedures, tracing the methodology that needs to be furnished with respect to all the feasibility, the tools, the survey that makes the path clear, is something that the JCI accreditation journey becomes very smooth. Okay, so that is called as a tracer methodology. Okay, what is a tracer methodology? Tracer methodology becomes very important when you evaluate something as a survey, you do one sort of an subject to inspection for some patients' concern. So conducting an internal audit, or I mean to say rehearsal before the final survey. So the tracer methodology is something like tracing actually or evaluating the care that a patient is getting. Going into a pediatric ward and just inspecting it doesn't solve the purpose. Is there an improvement with respect to the clinical interventions that are being given, or an operational deficiency has been sorted, or an HR particularly as a deficiency is met, or structural safety and structural requirements are fulfilled? So conducting an internal rehearsals for this part is extremely important. Okay. If there is a observation that it is not being done or not being fulfilled, you need to work on a standard repetitive cycle that is called as maintaining standard cycle. So this can be done 2 yearly, 3 yearly. Ideally, it is over a 3 yearly period, and the benefits, what I can say, are something which are not only attracting your domestic medical tourism, not only attracting your paying capacity patient, or not only making your institutions uh, in the earning businesses ahead to your competitors, but a major attraction is medical tourism, that too for international patients. Risk reduction becomes very important, that JCI accredited institutions are found to be very importantly taking and seriously working on minimizing the adverse events, near miss events, sentinel events. In a cycle, they are working on this. Operational efficiency becomes very important with respect to workflow. So optimizing the resources, maximum utilization of those resources which finds that are coming with a high level of investment. A shift and divide with the international patient safety goal will not really give you the benefit if the institution is not planning actually to put JCI and not even putting the trace methodology that I said. So whenever you are working on institution who has received a national accreditation like NABH or NQuas, and the institutions are going for JCI, they need to identify the difference what they are supposed to do, and not to just repeat those things that these institutions are not meeting up. The institutions need to work for those understanding which keeps us as a core of JCI, that your management is something which is requiring, your institution is something which is a institution which is more, not an institution which is doing with a clinical data, but it is doing a rigorous audit. So JCI people will always say you, or institutions who have already, or people who have gone through the JCI journey, they will say that we are always there for audit, prepared for the audit. The entire network or the entire teamwork actually that they have to do is like prioritizing themselves to the survival of the needs, the aesthetic needs, the structural needs, the deeply working on the clinical improvement. So it's like an honestly stating that it is one thing which is working towards the safety. The institutions who find that the institutions are something which are being seen something as a destination for some patient who are coming from abroad, or they are finding that there is a great faith that your institution has given them, that they come again and again for the services, for the family services. In India, particularly, we find that a lot of the patients are coming for their complex health bypass surgery, their robotic joint replacement. They are coming for a lot of their oncology care. So India has become a medical tourism market because of the JCI accreditation, accredited institutes for three things, especially for the joint replacement part, the oncology care, and oncology care, which are very, very recovery based, purely, I mean to say, very life saving also for some patients who are on the verge or getting the high metastasis, the highly developed cancerous condition. Okay. Admitting to the logistic challenges that institutions definitely face is no doubt supported by some institutions who also support the patient with visas and booking flights, making them those testimony and all that. That is something which is an attraction, and the institutions get benefit. That is not to be seen something that we have to discuss for the JCI. But yes, understanding the patient's mind, understanding the family needs are no doubt putting some of the institutions who are going for JCI. We'll be discussing more into the practical aspects of the case that we'll be discussing in a while actually after this. Um, I just grossly want to cover a few things also in addition over here that when we try to take an hospital who applies for JCI, they need to have a very highly developed trained team. Either the team should go for a visit to some JCI accredited institution. They need to be having veteran doctors. Veteran mean to say well versed with their practices, doctors who have a very high level of clinical experience and execution in their practice are veteran, have number of years of experiences. The nurses should be veteran, the administrators should be veteran. So all the descendants of this as a product, when you will have all these three level of people in your institutions, will make the journey of JCA very fruitful. Inch and inch, square and square of the institution need to pick up actually the trace methodology. The trace methodology, which literally puts you patient at a single step, that the journey of your patient for every sort of a step. How the patient starts the journey, the patient comes into an OPD. I'm talking about a acute, normal, mild and moderate patient. I'm not talking about emergency patient. Never a patient enters through the OPD who is very emergency. They come up through what? They come up with all your what sort of services? They come up with your emergency department. All your qualities are casualties. So every patient's fate is not of casualty. Some patients even enter through OPD also, and then the doctor says them with a very serious note that you need to get admitted. Or sometimes you are not in a condition, you are direct coming from casualty. Sometimes the patient's fate from casualty that they can get a very good discharge and they can go to the same gate from where people come in the OPD. That is the entrance gate where your visitors, your this TPA people, your receptionist will visit you. And sometimes the patient who has visited from that gate and they have got admitted, they might have to go in a bad shape, or they might even get a very fatal condition. They may even die. So I'm saying how you get your discharge is very important. Okay, it is showing that the gold standards that the international patient safety has cleared of 6 international patient safety goal. If the institutions start preparing accordingly, definitely the journey for JCI is not really far from them. Okay, so and beyond the safety, now the 8th edition of the standard has come, which puts you the newer development of concern, that is of digital security, telehealth, telemedicine, environment sustainability, patient rights and ethics. Na? These are something which are making for international, but even for the regular patient whose expectation are increasing because not only of education, but about health awareness. Health awareness is something which gives much a reason that you need to very much complacent to the patient need and rather not compromising with their needs. When you are trying to compromise with their needs, the patient will always put some sort of voice or complaints against you. The patient will not be really a dedicated patient to you. Who is a dedicated patient? Who comes repeatedly to your institution. Who is a dedicated patient? Who relies and who put a word of mouth and they even circulate the information that yes, this hospital, this particular doctor or this institution is very good. Who is something a very dedicated patient? Who finds that your organization is not putting hidden cost, or your hospital is very transparent in billing. Your hospital is upfrontly taking, okay, I repeat, upfrontly taking the patient's concern more important rather than just seeking the patient's income or patient status. So somewhere or the other, I am saying the equity aspect is also being covered over here. Okay, somewhere or the other. So this is something very, very thinly written. Okay. But there lies a fear actually always over there. There lies some sort of fear actually, because it depends, like JCI in which country. Even though we are a JCI accredited hospital, sometimes we find Indian hospitals who compromise with the patient's care actually. Sometimes because the impartial system which is made by the management needs to be crabbed up actually by those who find that the international patients are only their needs. Okay. The goal best practices for making very clinical pathway very safety or evidence based also try to sorry prepare a safety protocol which works on the patient's experiences. An institution who is not taking patient feedback, an institution who is not working on the patient experiences, an institution who is not uh, coming closer to the international patient safety goals really cannot say that they are the best practicing institution. I really reject actually. I can give you two major institutions in the world which are very highly reputed for these practices, and they can be claimed as one among the toppest institution to be taken as an example. Okay, what is that? One is the Mayo Clinic. Everyone will discuss about Mayo Clinic. Everyone will talk about what is Mayo Clinic. Mayo Clinic examples are being stated over there. Even Mayo Clinic also faces some sort of quality problem that is different. But Mayo Clinic tries to achieve the 99.99% of the excellence. And then comes John Hopkins. John Hopkins Institution of the US is something which is giving a excellence level of care. I'm coming with the reports, I'm coming with the references. I haven't visited this institution. Okay, no doubt. It is not that I'm claiming this only on the basis of the secondary evidences, but yes, all those researches, all those evidences, all those practices, all those institutions which are spelled into conclaves and conferences and are meted with the repeated global best practices, multilingual and state level or communications which are coming to us, always gives more reasons that these institutions are being recalled. Okay. Many times what happened, we discuss about a lot of complications, we discuss about infections, we discuss even about medical negligence and medication error. All medical conferences of doctors are fully only concentrated on giving these things. They majorly discuss on all these things. Okay. Okay. We dramatically, sometimes very drastically put all these things, that how our hospitals need to be very supportive for your practice. Now, as a doctor, you try, or as a nurse, you try to work more on your experiences. You give the best on basis of your experiences. What experiences should teach you in the future is that you should try to reduce the length of stay of your patient. I understand that in inevitable condition, in very emergent condition, sometimes you really don't know what is lying over there into the patient's disease condition. But ICU stay, which we find in the international standards, that Indian hospitals are having a very high length of stay of ICU of a patient. Why do a patient from that expected time period need to have more ICU stay? Because somewhere or the other, your prognosis is going wrong. Somewhere or the other, the diagnosis of your disease condition is not being cleared. Or somewhere or the other, the rapport between your teamwork, whether it is a doctor, your nurses, or your hospital protocols are not working properly, which hastens, which hastens the fast recovery of the patient, which even hastens even the fate of the patient. Sometimes your patient is something which is very expected, that a patient should really come out of that danger, which many times a clinician is always is in is in a mood to significantly improve the overall survival rate. But ultimately, most of the ardent or most of the eminent physicians fail to bring up a good survival rate in their clinical practice, because they are not singly handling over there. They are handling over there in a team. It is the hospital who needs to support them. It is a team that needs to support them. It is the entire complex procedure that these people have to deal. It cannot be an individual person who can deal up with these challenges. Okay. So I'm trying to put this care trip promises actually, which gives you more reasons for the working on the experiences which I made it very clear to give you and brush you up before your exams for the JCI part. We will come up with a small break of 5 minutes, and then we'll resume back actually to take a proper case discussion on JCI for. Okay. So now we will talk about a case actually, which is more uh, to be very important to practically discuss about the issues, like how institutions who are making efforts actually to take them for JCI and the employees who works to see that the institutions. Yeah, Amartya, allow me to put on my video. Uh,
Yes, sir.
yeah. So the JCI accreditation in corporate tertiary care hospital in India is a case actually that we will be taking. This is a hypothetical case that we will be taking. This case is coming with the observations that I have come across with the different institutions, which makes us more reasons for me to understand that how JCI as an institutions, uh, because when we try to talk about the globally recognized institutions which are giving more chances for us, that the Joint Commission International, which is a highly recognized body, which gives us more problems study elements, and which gives more emphasis on not only working on those problems or to come up with the challenges. The institutions makes us a reason that the institutions are based for patients and for the quality. The patients
Sorry to
which
intervene.
hi, yes
So
please.
your screen is not visible, sir.
That's what, because I'm trying to put it on, so it is coming like the host has to. Uh,
So
can
I have enabled it. Okay, sir, I'll just redo it. Just a second.
yeah, please do it. Host has to. We can ask the host of IIT Bombay. Yeah. Shall I continue? Okay. This case study for the JCI accreditation is coming from the overlook of the corporate hospital. The corporate hospital here, we are trying to say it is coming from the rigorous survey that is being done, and the accreditation which is being stated over here is something which is coming for the journey that the hospital has taken for an efforts the hospital met to complete this with Amartya, you inform the IIT team to put on the video so we can continue and the students will be able to get the benefit. So the accreditation that the JCI is awarded is based on a very sightseeing, understanding the gap, accessing the compliance part, and the measuring the standards, which becomes very important for an institution which is coming with a global reputation to take it as a medical tourism um, thing, or a benefit or a clinical outcome based benefit where the institution can be put as a JCI accreditation institution. And sometimes you may find a patient safety systems actually which gives more reasons for the institution, because the hospital becomes JCI accredited. These three things are which are primarily being put as a benefit. So let me put this corporate hospital case study, which comes a case study which has a benefit actually to discuss, because corporate hospitals are sometimes becoming institutions which are one which are coming as an multi-specialty institutions which are catering the needs of the tertiary level and are majorly located into urban setups. This hospital, particularly which I will be discussing now, is a 500-bedded multi-specialty hospital. This hospital takes its location in the metro city in the southern part of the state country, and it's an NABH accredited priorly, and the hospital is now aiming to go for a JCI accreditation. The hospital is making the efforts that the hospital needs to seek some more level of increasing number of the existing patients that the hospital is having. Yeah, I will tell you, tertiary is like tertiary level of care, primary, secondary, and tertiary. Primary is something, the basic level of care, secondary is meeting to the next level, and tertiary is which are offered at a higher level of care, which is surgical, and to up level of diagnostics and medication level care. So the tertiary level of care that is this hospital is providing in terms of the top level of services, which comes even to the national international patient. The pre-JCI, these institutions was something as an institution which was having a variation in the clinical practices. The hospital was not able to cover up actually the clinical practices in the proper way. And this institution was really not able to go to the patient's compliance to that extent. And when we try to see that these institutions come up with a consistently bad, or I mean to say inconsistent infection practices, infection control and prevention practices, the compliance part was being seen very poor. The second thing. The third thing was the medication error was something which was having a higher side or a gap actually. A bigger gap actually, which was not able to understand whether the medication errors are documented or are being clearly stated to be covered. The documentation gaps, which makes more reasons that the institution was being seen very poor. So the weak patient safety culture was something coming as a major challenge actually for the institution. The lack of quality standards which made this institution something as a quality driven, but was lacking into the standards of development of quality, was lacking into the standards of understanding that this institution really need to work on indicators. So the quality indicators were something which is very important challenge. Second was patient safety culture, documentation, medication error, and infection prevention and control, and variation in the clinical practices or poor clinical practice. 6, 7 major challenges were with the JCA. Reason because this particular hospital XYZ was NABH accredited prior. And the hospital thought that, oh, the quality team will make it more clear and will get the JCA accreditation for us. The key areas which were evaluated for going for JCI, which was giving this hospital and reasons that the issues and standards were more towards very clear towards meeting JCI. And the institution, when the institution was economically prepared, actually were trying to give more benefits, the JCI was projecting on two categories, that is patient-centered care and organizational management. When the patient-centered care comes over here for this particular hospital, the delayed admission and the discharge process was something which was making very cumbersome or difficult for the hospital to go ahead with this. The institution realized that the patients actually were getting long waiting, and even the discharge was also very. Ideally speaking, this was something a very disappointing point that the hospital tried that JCA wouldn't be possible. These issues were very much identified. But the quality team worked on the poor referrals. The quality team worked on focusing that the seamless patient journey is something that we should try and continuity of care should be provided. So the access to care and continuity was something, a goal that the team was trying to achieve. The second goal which makes this journey, accreditation process journey of JCI was assessment of the patient. The patient assessment in the previous case going with the pre-JCI that was incomplete clinical documentation, incomplete patient record, lack of assessment protocols, no? Lack of assurance actually for giving the services. So all these three things were making like the assessment was very incomplete, and the hospital has to develop a comprehensive plan for that part. A comprehensive plan, we should meet the initial, the mid-level, and the ongoing assessment. So the quality aspect was coming over here as very important. Then the third challenge which was met in the during the process was the care of the patient, particularly for surgical. The surgical patient were not being seen going through any surgical checklist. Surgical checklist, which becomes very important and interconsistent part of any surgical level care. Without following the surgical checklist, you cannot really assure whether your treatment have gone through a variation, your treatment has gone through a failure, or your treatment has come up with at any standard protocol. So the surgical care over here in this particular hospital was meeting major issues, and that was met. The next was in the medicine department, or we can say all the working department, that the problem was very common, as if like a common as most of the hospitals are facing. But here the problem was little addition. The addition was like there was lookalike sound alike drugs errors were major. LASA drugs. We call it as LASA drug. L for look, A for alike, S for sound, and A for alike. Again, look alike, sound alike. And additionally, with this, there was the poor medication reporting. If though there are some sort of an medication errors, if it is reported, if it is worked on, the medication management will become safer. Okay. And the patient rights, which was sometimes being seen as a priority in JCI, here the part of that would have required more time for this hospital to go. I think 10 to 15% of the entire process time of JCI would have gone on this time. The reason was most of the patients, it was found that informed consent was not taken. That is very important, that if your informed consent is not taken, JCA accreditation will be a failure for you. Poor communication on the part of informing the patient about their care processes, assuring that they have received this care or not, was also being very importantly seen. And this makes more benefit for putting the patient very responsible care. Okay. So the patient-centered standard was having so much of a problem, and the hospital has started working on this. Now coming to the organization management standard, where the very first and very important part is the quality improvement and patient safety. Whatever you have identified, now you have to work on them. Whatever you have identified and you have started working on that, you assure that you do it with safety. So the entire circle of quality will be completed in the JCI. What was the issue now in this particular hospital with respect to quality improvement and patient safety? That was no structured quality indicators. So it was something like that, a big question, how this hospital received any BH. Okay. We'll not go into detail like how the hospital managed to get it. The part of NABH that really needs to work up, and how the hospital is really sustained for that NABH. Okay. The second issue in the quality improvement and patient safety was lack of incident reporting. Lack of incident reporting cannot be only a one person task. Lack of incident reporting depends more on the culture, that how it is. Even though a nurse who has done some sort of an problem or has gone through, or doctor has done, it is being seen or by sometimes noticed by other people also. So sometimes by fear, sometimes by getting some response that your seniors are not allowing you to put it up, or like a blame culture will come on you rather than you will be asked for improvement. The reporting culture was something very declined, and the patient safety was increasing a lot, because when your employee think that the reporting is not important or it is ignored, patient safety concerns will no doubt increase. Then the very important part in the operation management part is like facility management. The fire safety gaps were major. The hospital has come across a lot of fire safety issues. Biomedical waste management compliance was extremely poor. Inconsistencies were there. Identification, role mapping, giving the tender, and because it was outsourced for this particular hospital. Mock drills in fire safety were not done. Risk has been seen in many cases actually that the staff themselves have faced issues with respect to the fire negligence. HR challenges was that the staff who was recruited, especially the nursing and even sometimes the other uh, health workers, they were inadequately trained actually for certain clinical aspects and even for quality, and they were not able to prepare. Though some of them were in the quality team, they were not being prepared for the documentation, and the skills that were required to meet this was poorly lacking. And the last and very important was of information management, that the information management or record keeping by the medical record department was poor. And the data that was giving you a decision for preparation for the JCI survey was not able to give you the proper decision. Okay. Now comes that when the hospital has applied for the JCI and the hospital was mandated to fulfill the infection control program. The hospital was based on the risk and surveillance, and the hospital major issues that were hidden and identified that high rate of HAI, because all these issues have contributed for the high HAIs. All the healthcare associated infection that has come up are one which are coming from this. Poor hand hygiene compliance, more realistic injuries, inadequate sterilization, improper disinfection, and antibiotic misuse was the key survey results. These were the major results. So you can say patient safety and infection control practices gives you major credits to clear your hospital for JCI. Now, what is that the JCI driven improvements have bring up to this hospital after that hospital has worked thoroughly for all the two major standards that are coming as a category, I mean to say, and the 6 international patient safety goals. The hospital was able to form a infection control committee first in line. The hospital formed an infection control committee. The hospital made a thorough surveillance of HAI as if like VAP, ventilator associated pneumonia, 40, okay, central line associated, catheter associated urinary tract infection, SSI, central line surgical site infection, and CLAPSI, central line associated bloodstream infection. So CLAPSI, VAP, COTI, SSI were something were taken very seriously. Okay. Hand hygiene training and audits were done hand in hand with all the 5 moments which WHO has stated, and protocol signages and even practices were taken and have been improvement with respect to monitoring also. Antimicrobial stewardship program came with whole 3 aspects of training, um, implementation, and even stewardship to take it very seriously. So these was very a JCI driven quality improvement activity. The CSSD department and the quality management department or quality department, intern quality department, they worked more seriously on developing the disinfection protocols and sterilization protocols for the institution. And taking these 2 departments very seriously, the hospitals were able to train the entire staff of the hospital for making the use of the quality knowledge, the personal protective compliance improvement to work up on those quality driven improvement that the team has taken to create an impact. The impact was seen, and over a period of 6 months of time, the impact was recorded that a hospital showed a resultant reduction in infection rate. The practices that were coming showing the poor patient outcomes were now slowly improving. Patient outcomes which were coming more not only from the discharge part or understanding the TAT, no, or even the service time or even the length of stay of the patient, but a safer, healthy environment was seen because of a reduction of fire safety incidents, no, incidents of no, poor maintenance, and even of biomedical waste management practices, which were very improved. Now we will try to see that the six patient safety goals, actually, international patient safety goals. You may see that all the six areas can be seen as six different categories. The patient identification was correct in this hospital. Effective communication was failure, which was to be improved. Safety medication practices, which were utterly a failure, which was made as a rigorous effect to make this third goal as a very important. Safer surgery was from not only from putting it as a right side or right procedure and every time right, but was on the right patient. That is very important. Okay, right patient, right side, right procedure, and always at a right time. So time is also very important. Okay, so that PSPT is very important mnemonic that you need to understand how you need to develop a safe surgery. That is of a right patient, right site, right time, and right procedure. And the very fifth important goal that was of infection prevention was worked up, and that was worked with the help of largely with the nursing team, has made more benefits actually, and even the pathology department, no, quality department has given a great benefit to them. The success was with the final goal that was like the fall in the risk reduction was being seen very stately. The issues before the JCI were completed, that is of misidentification incidents were reported or have drastically dropped down to 50% and more. Communication gaps among the healthcare workers and handovers, especially at a time of 8 hours or 12 hours duty, which were very commonly, were being seen as improved and has come up actually that they have met 70 to 80% of the achievement. Surgical error and the near miss events reporting, incident reporting was increased, mitigations were done, and safety protocols were followed. What was one which was post implementation? Post implementation is very important. When the barcodes of patient identification was done, the hospital initially faced challenges with that, and the hospital found that the protocols of handover protocols or standardized working on that made this a practice which is continued for years. The hospital is now in the second phase of after 3 years, and the hospital has found out that step by step that hospital has improved for JCI, which worked in a period starting from initial 12 months. The hospital faced that there was a great improvement, and now on the verge of completion of 36 months, the hospital is able to develop a quality policy of development, particularly for that hospital. In future, then the hospital will put up their staff training, or the hospital will develop their quality indicators or augment or work on developing the gap analysis. It will come across this 12 to 36 month of a journey. Initial 12 months of journey was very difficult, and after the 36 month, the hospital was able to prepare and show that what the SOP preparation that the hospital has done on the basis of the quality self-assessment and the quality documentation was enough actually to see that there are best practices which were pointed as an evidence-based practices for this hospital to show that the hospital is well prepared for culture of sustaining the quality sustenance. The on-site survey has made the hospital a point that JCI requires a person actually or a leadership who should take this uh, journey in a very strong clinical governance, and also making the hospital something as a center where the patients are traced, the staff interviews are very valuable, the records that are kept are something which are always reviewed and analyzed or audited, and the processes are observed thoroughly, And the safer matrix evaluation, which JCI is known about, is like risk-based scoring. All the risk-based scoring, which will give you chances to reduce the severity of the issue, will sometimes avoid the issue, or sometimes if the issue happens, the scope of the impact or influence of giving the severity very high will be reduced. Accreditation here, I am saying, is a decision that an institution should make. If a hospital is fully accredited or the hospital is on verge of working on NABH, or they are conditional actually that they are really willing, the validity for that part makes more clear that accreditation benefits will be for 3 years. The internal committee needs to work on internally for continuing the monitoring. The strategic plan they need to develop on improvement with respect to all the periodic survey, working with your quality team, the quality circle, and making the surveys very on and on. Pre-audit before the survey is very important, and the clinical outcomes that are spelled in the report, particularly for this hospital, were that HAIs were reduced, increase of the improvement in the patient's length of stay was reduced drastically. Disease who are being troubled with lot of medication errors, particularly because disease troubled means the patient gets troubled, and you work on decreasing the medication error indirectly will affect the patient's recovery and improve surgical outcomes, which many times are seen that 25 to 30% of major tertiary care hospitals are catering the needs of surgical patients, are catering the load of obstetrics and all that. So that is very important. Patient safety, no doubt, strong developing culture of patient safety, which is not only from reporting or identification of incident, but also working on adverse events reduction. Okay, adverse event reduction is sometimes giving you a chance that your institution has developed a standardized protocol, have worked on the better documentation, have worked more on your training, and is now being giving you a fair outcome because of evidence-based care. So this is called as an organizational improvement over large. And now with the patient experience comes more from your staff's benefits. Your staff who is very properly trained, skillful staff who are coming with a defined role, they come up with the accountability, they come up with an improvement in their team efforts and team engagement, always will lead to best patient experiences. The patient satisfaction score will increase in those institutions who come up with the best patient treatment, or I mean to say comprehensive patient care or patient centered care. The better communication, the increased trust in the patient, and the very important is the patient satisfaction score increasing are being stated as the success of JCI. JCI no doubt will require a lot of increased international patients, because without international patient, the strategic impact of the financial um, uh, I am to say investment will not be fulfilled. All the medical legal risk which brings hospital sometimes a very uh, unexpected uh, investment, or sometimes requires more efforts, are also to be met by the top organization whether they have to go for, because this is a decision whether the institution has to go for JCA or not. If they are trying to improve their reputation, if they are trying to see that increasing in their clientels, particularly of medical tourism, if the hospital is coming with lot of legalities in terms of litigation that are filed against the hospital need to change, or hospital need to go even for a business more for the international patient, they can roll out. Otherwise NABH is enough actually, particularly for private hospital. But the role of JCI now in healthcare improvement um, is being contributed by the continuous quality improvement. Continuous quality improvement also is being spelled in NQAS, but continuous quality improvement in NQAS is more from the public health point of view. Here it is more from the data driven. It is here more from risk management. Here it is more like standardization of care. So these three words becomes very important in JCI, that is data driven decision making. Data driven decision making is something which works more from the support of the different evidences that are coming from data. You are able to make the decision. Either it can be a diagnosis for that part, it is working on even HMIS, or even sometimes it is about the auxiliary care that a hospital will provide, whether it is a corporate or a private. If the data driven decision is making, they are able to cater the community or even the people they are trying to go and treat it outside. Risk management approach is very, very important for all those departments who face more risk driven patient. And standardization care, whether it is a pediatric or geriatric, the role will see that the institutions are transformed. So now coming with the strength of JCI, the strength of JCI is like you will get a global benchmark. What is a global benchmark? The global benchmark is that golden part, and your medical institutions or academic institutions, whoever are seeking that golden seal of approval, they will find that this accreditation is of a hallmark that they will get of a recognized gold standard, that is of a patient care and safety, which is like of international healthcare institution. So whenever an institution which you have seen is of gold seal of approval, it distinguishes your institutions because they have accomplished all the part. Whether the institutions have multiple benefits, that is different. But no doubt the seal, if you get of the JCI, the institution will be enough to display the capability and the commitment towards the healthcare work. The entire programs of gold seal of approval will come only when you build a culture of trust to your patient. The trust can be built by medical services, the trust can be built by patient safety, and the trust can be built by the assured level of care. The the repetition of your staff, the the development of the places that they acquire in terms of the competition that they get a sort of an benefits, like enhancing or even developing their practices. If your hospital is able to put up that reputation, to put a professional service, you can even work on retaining your employees. Okay, lot of the businesses that are more driven with quality and are more working for that on quality achievements come up with very uh, important challenges of high cost. Okay, and cultural resistance of older people versus the newer people. People well versed with technology and people with poor technology. Cost, because always healthcare is uh, always being seen as an cost effective, lot of documentation driven and human oriented. So always see that this comes as a challenge for any institutions who are going on JCI. Whenever you are studying all this for quality, you will get more reasons that JCI institutions are a very powerful tool for healthcare quality transformation. And this is not only the one accreditation. There are many other that we have seen in QAS, NABH, JCI, ISO, we'll be seeing. So JCI are more in corporate hospitals. JCI are nowhere seen in public or private, particularly. JCI are for corporate hospital. They are ensuring the high standard of patient safety. They work upon the robust infection prevention practices. I'm saying robust, and also on quality improvement. So ultimately, when JCI shift is done in a hospital, your hospital will be a very reactive hospital towards the patient. Your hospital will be a system driven hospital which is coming out of a different department as a system, and they are being seen as a multi stage. Okay, and ultimately the two things will come, that is patient centered care and operational standard, and aligning to Indian hospitals, particularly when we try to talk about the global practices, and when we come up with the real experiences, what Indian hospitals, I can say that Apollo is one an example that I can give you, that one among the first hospital in India to receive the JCI accreditation. I think it was in 2005, Indraprastha Apollo, Delhi, has received this, and multiple such hospitals are across in India, either whether it is in Chennai or Hyderabad or even Delhi, even in Navi Mumbai, Mumbai. So before JCI, these institutions were variably, these particular institutions or these institutions of Apollo were facing with all challenges of clinical practices, limited standardizations protocol, inconsistent infection control practices, lower reporting of medication error, very common thing that JCA face. And patient engagement was also poor. Though most of these institutions who have reached to JCI, what I spelled out, particularly for Apollo, were NABH priorly. After JCI, this institution has seen a strong safety culture. Near miss events were reduced, adverse events were drastically cut down, and reduction in infection control rate was there. Standardization with uniform clinical practices and coming across all the units and not leaving any unit left over. Data driven quality was something as a key that these institutions were able to get. Apollo was able to get the JCI accreditation. So the transformation journey was from a doctor dependent care to a system based care. So what is the mantra that Apollo Shift has taken? That is a doctor dependent care to a system based care. And it was more driven with the influence. Apollo Ahmedabad is also one among the hospital who has taken JCA 2016-17, and it has also practiced with the compliance need that were measurable with different elements. The hospital has also worked with the safer matrix analysis and strong clinical governance, which the hospital was lacking, was better. Also, the quality culture, which has made the hospital sustain with respect to the patient safety outcomes. So also, one more name come in my mind is of a Fortis Hospital. Fortis Hospital, widely known for JCI accreditation, Fortis Mumbai, and the rapid expansion that this hospital has taken is more with the quality journey, the quality documentation, the clinical pathways, and even the standard care pathways. Enhanced international patient uh, services and giving more reasons that this hospital got more medical tourism. Max Healthcare and Medanta also in the Medicity has received the JCI. The previous challenges was of patient rights and medication safety. Now the hospital has surpassed all this and has already covered. Now giving you at the end of the discussion of the JCI that what are the aspects JCI primarily look on. JCI looks on clinical care. JCI looks on infection control, patient safety, improvement in quality documentation, staff training, incident reporting, patient experience, and lastly is the overall base of the quality management. Now, most of the institutions who have brought JCI were protocol driven, evidence driven. Previously, most of these institutions were doctor driven. The hospital has come up with a very proactive surveillance. Hospital has more educated the patient, have audited their clinical and non-clinical services, standardized their services, and continuous competency-based learning was more being seen. Now, your hospital, if suffering for quality issue, they can also go for JCI if they are really able to come up with this, and they can also reduce the HAIs in their in your organization. Example of taking lower infection rates and making it a success story was the JCI accredited Apollo Hospital. Now, when we talk about the different benefits, we need to even understand the challenges, and high cost of accreditation is one very important in JCI, where infrastructure, training, continuous improvement, all this will require a lot of money. All your extensive SOPs that are developed and record keeping will also require a time that is time consuming hai, JCI. Culturally, it has become very important that your doctors will be resistant, your nurses to some extent will be also resistance because they will have to do a lot of work. You need to work that your staff from autonomy to protocol adherence. So operational challenges will always be continued for any accreditation. You need not to worry about that. You need to work on doing a continuous audit. Continuous audit is a work of a quality manager. Data monitoring and data driven decisions is the second work. And the third is like policy updates. So infection prevention control needs to be a key learning lesson that if you are trying to take a training module for a hospital. But when I'm giving these examples of Max, or I'm giving the example of Medanta or even Apollo, I say that these are all corporate chain hospitals. Okay, the transformation from the traditional care to gold standard healthcare is a prime priority for this institution, and the institution have done that. No doubt that the success lies into their hands. Strength of infection control and patient safety was being seen a system problem that they have taken up. And very importantly, when you have to take JCI, measuring the improvement in clinical outcomes is always important, and patient satisfaction. This institution have done. So, what is the final takeaway for JCI, particularly for you people? That when you are taking JCI, don't see it as only an accreditation. JCI is a comprehensive transformation of an healthcare organization or an organization which is trying to seek healthcare quality as an quality framework. Okay, so quality framework is the transformation. So quality framework is derived with three components. One is your system should be improving, your patient safety should be a priority, and your outcome should be well balanced and evidence based. Okay, so we'll take again a short break of 5 to 10 minutes. And I think that the requirement of commitment is very important when you have to work in quality. The cultural change that the institution needs to be expected is very important, and continuous effort. Continuity is very important. Continuity is related to time. Cultural change is something which is a habit and infrastructural problem, and commitment is something actually which is coming by the mental exercises, which is driven by motivation, support, and governance. Okay, so with this, we'll take a break actually for a while, and then we'll come back after 5 to 10 minutes. Don't log out actually. Stay tuned to this. We'll start with the second part of today's session recording for next part, that is of ISO. Okay, thank you. Okay, we resume back. Now we will be discussing on ISO. What is the international standards that is taking us ISO to be discussion over here? We will come up actually with those major discussion, which gives us to us for Indian hospitals, particularly when Indian hospitals are being taken for this point of view of discussion, what are the requirements? Yeah, the video is stated that uh, host has stopped it. Okay, okay. Ask the host actually because I'm trying to put on the video. Um, okay, no doubt. So I was saying that ISO certification for Indian hospital as such becomes very important when Indian hospitals are taking the ISO certification very uh, as an increasing need, and Indian healthcare industry is seeing the significant benefits of ISO, as ISO certification becomes very important for the institutions who are established from many years, and they are taking this international organization for standardization as something which is very relevant to the standards which people have taken in other industry, have taken even for brands, manufacturing, product industry, ISO 9001 or ISO 13485 or even ISO 15189. So all these numbers and the dealings that have ensured us that a product which is coming from ISO is coming with quality, a product which is coming from ISO is coming with safety, a product which is coming from ISO is coming with accuracy. So accuracy, safety, quality are being seen, not only the names that is being spelled on the advertisement or a hallmark of the quality, of ISO, but the quality is assured with safety and accuracy. You will get the same level of alignment in the processes actually if the hospital who you find is something which are ISO certified. ISO certification is something which is being seen as an institutions who have developed their processes, their procedures with a very dedicated way, or the processes that have aligned actually with documentation, the processes which have come with a thorough staff training, the processes which have come with a lot of external audits. The certification of ISO will demonstrate a commitment that the institution has taken with a culture of developing quality as it as if of own. As if of own, I'm trying to say that because when you're trying to provide a high quality healthcare services, it cannot be something like it can be only being taken with um, an external agency. It is to be taken by enhancing the quality and patient safety in the institution with continuous improvement. So to maintain the continuity, ISO is very important. So ISO as an international body or international organization of standardization comes with a consistent and confident effort. I'm saying consistent and confident efforts, which is giving more reasons that when you are compliant with the global standards, when you are trying to make your institution more closer to the global standard, you will initially develop a sense of assurance and confidence to the patients who are coming to you as an important stakeholders, and they should get equal opportunity as a stakeholder in your institutions who are coming for the institutions for health services. So the ISO certification in healthcare, particularly in India, is referring to the procedures that the healthcare organizations or hospitals who are trying to adhere with the international standards, and the set of the standards that are being prepared by ISO are ensuring, as I stated, efficiency, safety, and quality have to be benefiting the patient with the need that the patients are being seen as principal and very first important stakeholder. The healthcare workers needs to be emphasized more on the quality management system, that is a QMS. And when quality management system is being seen with important studies that have been taken, that how ISO has improved different industries. Now, you may find a commitment that ISO try to give the quality as an prime importance, or quality as something called as assurance. The hospitals here, if they are getting high benefits of ISO certification, they need to be designed with the creating always or always producing the medical services as a first line. You need to come up with the devices that are very advanced. You need to come up with the medical requirements that your patients are expecting, and you will fulfill them. You always come up with a tailor-made approach towards the quality aspects, where your medical testing of processes or even surface testing of any of the incident which is reported for any hospital acquired infection, or even your medical lab reports are cross-checked actually, or sometimes your real results of your audits are contributing directly towards the patient diagnosis and improving the length of stay of the patient. So this should be the practical implications. The practical implications also go with an applicability. The applicability will be finding out a place actually in those medical laboratories. So medical laboratories will be one beautiful way that a hospital can start with, or the pathology department. So there will be lot of gap analysis that you will get. There will be lot of areas of improvement that a hospital will see, and implementation will be coming as a challenge. Implementation will be coming as a challenge because a lot of modifications that you will require to put up from your healthcare workers, your organization, will be more for the processes. What sort of processes challenges? It will be more from your policies, your procedures, your alignment with the requirements of ISO standard, because it is not only being coming as a global but as an international standard, which will come up to give you more and repeated trainings. The trainings will be something actually which will give you reasons that your organization is one which is maintaining the requisite documents which are required by the ISO. You will be including all the quality manuals, you will be including all the procedures, you will be working on all the instructions which are being given according to those guidelines. You record all the things. So it is like an institutions of quality. Yes. So ISO is like a quality institution. You can say it's like a quality driven institution. It's a quality institution. You can learn from those hospitals who have already got quality certificate of ISO. So these documents prove that your organization is compliant. Your organization is compliant with the ISO standard. So it is like a producing the evidence of your service delivery. Training and awareness is a part which makes you that your staff, your every staff from all level of your institutions are implementing the changes of ISO. Ensuring that whether it is a model of a car product, no, as if like every employee in the organization is comprehended with the role that they are getting for development of that product. You may get a very high price of that particular mechanical automobile product, and if you find that the organization has meet up the ISO standard, it is something like the maintaining compliance is something very important that you are preparing a benchmark every time. So how that will be achieved? It is with the internal audit. Your internal audit is something very, very important. Your internal audit is something which is conducted in your organization, which is assessing that your product, here we are putting the patient as a product. So the product or the patient's processes, which are making the patient's health services more compliant with the ISO standard, they need to identify where the improvement for a particular group of patient or an hospital epidemiological surveillance, which will give you more chances of reducing the infection rate, or the corrective actions that are being taken for improving the patient safety protocol, or your standard treatment guidelines, which is not coming in the basics also needs to be drastically improved. Okay. And also the external audit, which is a choice based. So this is more like you are choosing the accredited certification body and you are asking them to conduct an external audit. The reason is like you are making some sort of an assessment of your own internal team, what they have produced as a result. The ISO certification body will evaluate your organization practices and they will try and make it more that they evaluate it process driven. Okay, process driven. They try to determine actually that they will give you equivalence of what your team efforts and the assessment of the Excel team, and the comparison will give you more the requirement whether you have met the ISO standards or not. So the certification decision is wholly based on the external audit and not on the internal audit. Internal audit is for improvement. Internal audit is for preparation. Internal audit is for competitiveness of one department, one unit, one entity actually in a ward versus the other entity. But the external team will give you certification. The external team will determine whether the grant of ISO certification to your organization is done. The grant actually will give you something as an benefit to your ongoing compliance. You can develop over a period of time that a periodic surveillance of your audits will give the certification which will ensure that your organization meets the ISO standards requirement over a period of time. Was the ISO certification in India, particularly in healthcare, was being seen something as a dream? Yes, it was. because in 70s and 80s it was something actually that institutions, healthcare institutions, hospitals were not being serious actually towards. In the late 90s there was a commitment which was coming to most of the institutions who were thinking about quality. Patient safety was being seen as a very minor. Now it is being emerging as a major facet. And now continuous improvement is something which is being seen as a key to maintain and to sustain quality in hospitals. Okay. Ensuring equality and equity with respect to healthcare quality is something as a dream that Indian institutions will be coming. And now the enhancement towards ISO for most of the institutions who are trying to talk about or are completing ISO, they have to come up with the reputation. Okay, reputation and competitiveness, which will give you a reason that your institutions will be futuristically being seen as an ISO certified. Okay, so India, because of competitiveness, because of reputation, the Indian hospitals have taken ISO. Otherwise, Indian hospital would have been in a very bad shape if this would not have come to them. I always credit to medical tourism. I always credit to the emerging medical equipments, the emerging pharma trends, na? The latest development which has given Indian hospitals that our ISO certification in India, the expertise, the provisions which are coming are one which are teaching us actually, or sometimes I may say that they are creating automatic cells. The cells are for the healthcare workers. They are the representatives from the organization who are continuously working on one function of quality. As if like they are taking it as a campaign, they are taking it as a mission, and no stoppage occur into their work actually. So they work on the flow charts, they work on the operations, they work on all the access of accountability, efficiency in a continuous way. That's the reason I told that ISO certification is something like you are developing an institution of quality. You are developing a philosophy that ISO as an specialty is being seen that you have understand the ISO accreditation or certification in hospital because your hospital is requiring to look on various standards. Okay, that's what is called as competitiveness. And your hospital is working on the operational components to improve in terms of meeting the efficiency. That's how it is being stated as a reputation. Whether the general range of quality will come or a specialized range of quality will come with respect to the macro and micro part of that, whether your laboratory is only able to beat up the ISO certification or your particular department, MRD or CSSD, the foundational core that I want to put over here is for ISO is like it works on patient satisfaction. Rather using patient satisfaction, I may use customer satisfaction. It is trying to maintain the consistency. It is working on the process improvement and the risk management. So these four elements give you more reasons that your institutions are a highly reputed and a highly competitive institutions. Now, especially when the prices of the medicines are increasing, emphasis by the doctors, especially of medical labs, testing has come up. The medical laboratories in our country who are trying to get ISO certification, they need to work more on the two aspects. Again, what is that? Competitiveness and reputation. But along with that, medical labs need to work more on reliability. In patient care, reliability is very difficult to prove whether you are reliable. Now, you can be reliable to one patient in terms of surgery, but whether for every patient you will be reliable or not, it is difficult. In terms of lab report, it is the reliability is very important and which can be also proved with the help of evidence. So reliability is very, very important in medical laboratories compared to for patient. In patient part, what is important? Customer satisfaction. If your patient is satisfied, even though you have developed some more stitches or have given more time for the patient in your hospital. A hospital, the patient has to stay for a number of days. But if you have done a proper work and the patient is satisfied, I think that is very important for a quality, especially for Indian patient. But for medical report, the reliability and the quality is very important. If your lab report shows something wrong, and on that wrong report, your doctor or your image is spoiled. Na? Your doctor's results are wrong, stating that your diagnosis because of that lab report, or sometimes you are defamed actually because of your status of your disease identification. It gives a major problems for you. So reliability comes very, very important in medical labs. Now we'll talk about the ISO part of hospital workers, healthcare workers, doctors, nurses. What ISO tries to do? ISO tries to do अभी we will अभी हम comparison करेंगे JCI का और ISO. Now in ISO focuses more on safety and well-being of the healthcare worker. There it was more on assuring the fire safety, hospital safety, patient safety. But ISO is speaking about more well-being of the healthcare worker. So you can understand ISO is little comprehensive. ISO जो है healthcare workers के बारे में भी बात करता है. ये थोड़ा component, this particular component is also being seen in NQOS also. Along with well-being of the healthcare worker, ISO also thinks about occupational health, safety of the employee by mitigating the workplace hazards, or providing them identification challenges, sometimes with respect to gender, with respect to your qualification, with respect to your race, with respect to your identity of caste, religion. Many times people face a lot of safety issues. These are something equity aspects. Very thinly, not broadly, ISO has also covered this aspect, which is very, very important, especially people practicing in Indian setups. Okay. Even in international setup also, nowadays it's a major concern. Also, the information security, which has been increasing nowadays, when we are in the VUCA world, where a lot of information will be coming to you. In future, you will be in the world itself. The VUCA world has started, where you will be with lot of information, lot of unexpected situation. You will be in lot of instability. You will be with lot of thoughts. You will be with lot of global challenges, environmental challenges, lot of sensitivity issue, human relationships. So what the modern philosophers have called it as? Modern philosophers have called it as a VUCA world. And VUCA world will be something our new generation, our current generation, and even our generation to some extent will face this. How much you survive, your future for VUCA world will be there. I'm not trying to scare you. I'm trying to say that the information security management will be the challenge, and the challenge has been met as an important component in ISO. ISO is also trying to take care of this. What ISO has done in the information security management? ISO has done a crucial but a very protecting part. ना आपको प्रोटेक्शन सिखाएगा कि इंफॉर्मेशन तो मालूम नहीं कितना सेफ रहता है, बट क्या होता है, इफ यू आर थॉट अबाउट प्रोटेक्टिंग योर इंफॉर्मेशन, योर डाटा विल बी सेव्ड. सो व्हाट इज आईएसओ डूइंग? पेशेंट का डाटा जो है, डाटा सिक्योरिटी, adherence to the privacy legislatures, actually your rules and regulations which is given by your country. Okay, we have healthcare law in our country, but to meet those in terms of implementation and regulation is little bit a challenge. But at a global level, these practices have started. And very important, which is one which is related to One Health part of environmental health needs in future. ISO has ensured that the institutions, especially healthcare workers, manager, they need to see that your hospital is working towards managing the biomedical waste management practices. In future, biomedical waste will be something a greater problem to the environment and will create public health concerns. It has already started. Energy and sources, especially I'm talking about natural energy, will be something very, very seriously will be taken in future. And the impact of that has already started. Okay. So eco-friendly practices, what is called as green hospitals, is something which is being seen as a major component that ISO is taking. And no doubt, very importantly, the healthcare quality, which you people are more concerned about, developing a standard and a policy by the institution themselves rather not relying on others. That is also that developing and creating a culture of quality, as if like every person in the institution will think about quality and see the patient as patient-centered care. Okay. Even the NHP 2017 is talking about National Health Policy of India 2017. The latest policy is talking about patient-centered care. But what a bigger load on the patient-centered care for public institution is like public institutions are more driven with the challenge of infrastructure, poor human resource, and the quality in terms of service delivery. So if your approach is patient centered, the public institutions will have more problems, especially for equitability and equity. Because without equitable and equity, the sustainability of the public health institution will be a bigger question. I'm not stating that a public health institution will not get ISO or they should not go for ISO, but to develop such a standardized healthcare quality model is a dream for public health institution. So public health institutions are more driven with patient-centered approach, more driven from preventive model. And now we are talking here is mostly of a curative model because hospitals are more towards curative model. The lower institutions in healthcare, that is primary, secondary, your health and wellness center, PHC, CHC, your sub-district hospital, nursing homes, they are more towards more something as preventive and promotive level of care. What is the curative level of care is something which is offered in tertiary care hospital, corporate hospitals coming with the setups or trust hospital or even government medical colleges or district hospitals. So the key components that ISO puts over here is like assessing the hospital's current practices. What are the hospital's current practices? Whether it is adhering actually to the ISO's requirement or it is going against the ISO standards requirement. And if it is going against, you have to improve that. That is the basic thing. It is not that ISO will ask you to do more greater thing. It is only that the basket of ISO's requirement for quality is bigger. The documentation control is established by developing, maintaining, and updating the policies. Like you need to develop rather not rely. You need to maintain to give a proper call as a recognition to work on and update the policy. It is not that policy should be a document and just kept into a cupboard. Okay. Along with that SOP, standard operating procedure. It is not that your standard operating procedures are mentioned over there, are listed and are documented, but you people are not following. So document control is something completely given to the institution and is nothing done by anyone else. The evaluator will have their own things. No doubt you need to adhere and work according to that. That is different. Proactively identifying the patient and evaluating and mitigating the risk of the patient safety is something called as risk-based thinking. Is it that the ISO institutions are always asking you to think about risk? No, it is not asking you to think about risk. It is asking you to meet the risk. That is called as risk management. How do you ensure about risk management? You are doing a very standard operational processes. When you know that you have to carry a patient from particular corridor, you have to take the patient into the lift and then you have to put the patient into ward. You know the entire way If your operational challenges are meeting you, that there are hindrances, there are some problems that your patients flow from one particular department to other particular department will be having a lot of hassles, you need to meet up those, because sometimes there is a risk from one department to other department. When the patient is being transferred, there is a chances that your patient may fall, that there is a chances that your patient may be touched by other people, or the contamination of infection will be there. There will be chances that there is a shift of some sort of medications from one to other, and there are a lot of issues in terms of teamwork, which will be more created when you are transferring. Okay. And hospitals which are very, very unprecedented with lot of incidences, hospitals which are driven with lot of huge patient load. I'm talking about public hospital, especially even trust hospital, where the focus for maintaining the service delivery is very different. You can admit the patient, you can continue with the patient, but if your patient is getting something very exaggerated actually, okay, and a patient requires a lot of attention, so it is very difficult for one sister to even attend 10 patients. Now, on an average, what has been the stated load that Indian nurses, particularly in public hospitals, are facing? The load is of 1 is to 70 or 80 patients. In 24 hours, they have to come across. I'm saying 24 hours. Why? Because sometimes they get even duty of 24 hours, back to back duty, most of the time. In lesser times, as you say, of 8 hours or sometimes extended of 12 hours, they have to see 60 to 70 patients. The doctors are morely, Indian doctors are to stated that, especially for their IPD part, they are seeing more than 25 to 30 patients in their one visit, or sometimes going for 50 also. In the OPD, public hospitals, doctors are seeing more than 150 to 200 patients. Some are public hospitals, district hospitals, the load is very huge. I'm not talking about those doctors who are really not seeing it. I'm not talking about the conduction of work which is done in terms of your morals. I'm talking about the input, throughput, and output. You all people have heard about PDCA, na? Plan, do, check, and act. In quality, what we do, if you are not able to do that work properly, what we will do? We will plan the work. We will do the work according to the requirement. We will act that the work is something to be taken in a very proper process part. Okay. And sometimes when you say that it is required in mid, that whether your work, whether it is being evaluated, that is a check part. So you can say it can be the PDCA cycle, which will be fulfilled with the interdependencies of your process approach. If your work is not done, you have to again repeat it. So PDCA will be completed for that. Internal audits will help you to increase the compliance of the ISO standard, the staff training, which is very important actually for all accreditation, for all quality part, ongoing compliance, ensuring the staff to work more on the skills, get qualified staff, put them on the roles, make them that they are working on the quality management system. They also work on the TQM part, the total quality management. They focus on the operational excellence, which is coming always. Operational excellence is equal to patient safety and quality. Okay, whether it is a standardization of the processes that your staff is understanding about admission, or whether it is about the discharge, it should be equal. You should give equal level of excellence. Okay, the care delivery part, which is very important when we try to talk about the patients, especially for services which are coming from maintaining the essential drug list, or procurement of the drugs, or sometimes for the medical devices that your hospital is like, the supply chain part I'm trying to talk about. I'm trying to say about the goods that the hospitals always need to keep up in stock, and your supply chain is something very, very maintained. So when you're trying to choose about the authority for certification, The ISO makes a periodical assessment to maintain the certification, usually occurring annually. And annually is why? Because your internal team will be given a chance, whether quarterly or 6 monthly, they will do their part. They will make up an effort to come up with the requirement, and understanding that how ISO certification or accreditation is something a formal recognition. Auditing to the best competence award is one only a fulfillment, but most of the work for your ISO is done by your internal team. A very specified way to deal up with this is that your institutions are sometimes actually giving you a chances of one way actually that your institutions are meeting the requirement in a very standardized way. Why the most relevant exercises that are being stated by a lot of institutions which are stating that we are working for ISO certifications and we are not able to get it? Because you are not evolving. You are not evolving to get changed. You are not evolving to maintain high quality of standards. You are not evolving towards working safely or allowing safe care. You are not working and delivering the efficiency which is very paramount important. So if your hospitals are evolving with the phase or has come up with a very recent day, suppose like a small hospital has come and slowly they are scaling up to put more beds, the hospital face an increasing pressure of service delivery. Or a new hospital which has come up in the catchment and exceptional patient care with adherence to the regulatory requirement is required, they require more human resource. And human resource is a very powerful tool to address the challenges. Hospitals cannot work without challenges, I am saying. And offering the globally recognized framework is the work of ISO. ISO will give you all the best practices which are done in the world. ISO will give you all the achieving and maintaining ISO certification for hospitals updated. So your hospitals are evolving according to the global needs. As if like you are not into a jungle and you are just running your businesses, whatever you have done up. So your doctors will get updated, your administrators will get updated, your quality managers will update it, and all the blueprints that will be provided to you for the actionable insights, the plan, the strategies that will give you more chances that your institution will be something called up as an institution of ISO certification. ISO certification is a one size fit all solution. It is something like it is a customized. Okay. So one size fit is not something which is a word which is spelled for ISO. It is all time. Means like you can customize it according to your need and you can work. It is not that uh, you will be halted. You can work. It is like a unique way, as if like you are a quality culture organization. Huh? You are an organization which is a itself a quality institution. Okay. And your organization will be an organization if they have to benefit from the ISO, they will be enhanced patient care. They will work on operational efficiency. ग्लोबल रिकॉग्निशन भी मिलेगा, रेगुलेटरी कंप्लायंस भी रहेगा कि आपके लीगल लिटिगेशंस कम रहेंगे, आपके रेगुलेटरी कंप्लायंस के इश्यूज कम रहेंगे, लोकल रेगुलेटरी बॉडीज एंड ऑल दैट विल seek lesser penalties. And employee satisfaction, we haven't uttered employee satisfaction till now in the discussion. Employee satisfaction is very important, and which is being seen in ISO only. When you are working towards your patients' occupational safety, occupational hazards, their job engagement, job enrichment, you are giving them rewards, a lot of the motivation, your employee will be satisfied. So a safer and more organized hospital which is working on reducing major physical environment problems, no doubt the morale of your employees will be increased, the retention rate will be dropped. Okay. Competitive advantage is very high in ISO certified institution. You will attract more crowd, you will get more patients, and you will develop more partnerships with smaller and even bigger stakeholders. Okay. So what we'll do, we will go now into the what industry says about ISO. Very important, no? Even the other industries, even industries, particularly in healthcare, because healthcare industry is not only one single entity. Healthcare industry is driven with support of pharma. Healthcare industry is more relying on insurance. Healthcare industry is about medical device manufacturing, na other education department, education industry, whole lot of different industries which are coming are also something like you require a convergence with them. Na lot of different sectors which are coming for. So ISO certificate for the hospital is relying more on the work support of others also. So healthcare providers, particularly for hospitals, clinics, specialty units, diagnostic units, they ensure quality and safety, and so they are getting more ISO certificate. Even other industries are also getting ISO certificate. Collaboratively, also the ISO certificate meets can be met, and if the stringent quality requirements are there, like medical requirements, surgical requirements, na, and when your tests, laboratory instruments, pharmaceuticals, particularly for critical clinical trials, the drug administration, drug things, particularly partnering with a big pharma company. So the pharmaceutical companies also can go even a smaller, not only in bigger, but insurance also is something which is an add-on. Insurance is an add-on because nowadays guaranteeing the quality of care through patients' satisfaction is something insurance is being given. Supporting the patient in their healthcare needs, insurance is giving. Making the preference of the specific hospitals to the patient, insurance is given. So insurance companies are something playing major role in getting ISO certification. Preferring ISO certified hospital is something a job which most of the insurance companies are giving it up. So government agencies also has some an addition along with this. Working with an ISO certified healthcare facilities to implement public health program is something very much reasons that your PPO, the public private partnership, PPP, or public private mix actually is giving. Sometimes you have good reasons that if you have to work with the government agencies, you have to work with the government, your ISO certified facility or your institution will give you chances that you will have a strong support by this institution. You will get more support from them. You will develop a rapport for getting this. Okay. So we will take, as it is an extended lecture, we'll take again a short break. And it is very important for you also. So I will give you a break of 5 minutes, 5 to 10 minutes. We'll resume back. We'll go more on what are the different steps actually to go for the certification of ISO, how ISO is achieved, and the case study part is very important. That is which is prepared. I will discuss that, and then we will take ISO and this as a difference actually in achieving for the definite role that institutions are nowadays seeing whether they have to go, because it is an add-on. ISO is an add-on to NABH. Okay, NQuas, it is completely with public institution. NABH with uh, private institutions, charitable hospital, and to very smaller extent to public. NABH is very popular in India. Na? JCI is something which is coming with medical tourism and international hospitals and global multiple chain corporate hospital. And ISO is something which gives you more reasons of sustainability, more reasons of a quality driven organization. Okay, yeah. So we'll have a break of 5 to 10 minutes. Okay. Coming back to you for this ISO discussion and ISO part of discussion, making that institutions who are taking ISO certification as a need or their future requirement, and when working towards the comprehensive working for quality, and when healthcare organizations are taking quality as one, it is which is very important when you are making these institutions to be seen as an institutions which are implementing quality in a very serious tone. So the case study that we will be taking for ISO 9001 2015, which is one that we will be discussing as a standard, that ISO 9001 2015 implementation in a private tertiary care hospital. The JCA also we have taken for a corporate. Here it is like we are taking an example of a private hospital. Let me put you that ISO 9001 2015 is an internationally recognized quality management system. This comes with an requirement that the standard, which is widely adopted by healthcare institutions, which are to make the institutions more patient safety friendly, which works on the clinical outcomes driven with the healthcare workers' clinical excellence, and even the organizational efficiency, which is done by the institution or by the management. The focus of the ISO certification projects towards the process-based approach. There is no part which is stating that they are ignoring the patient. It is a process-based approach. So process-based approach is when the fundamental. The risk management is secondary. Documentation comes as a third, and very important is like the continuous improvement. So this is coming as a circle, which gives you process starting with followed by risk, by documentation, and by continuous improvement. So you can understand that why ISO is being called as a very comprehensive model. In India, many corporate tertiary care hospitals are implementing, and they are seeking also. They are also requesting for getting ISO certification. They are working on the standardization of their operation part. They are working on the patient trust. They are working on patients' service delivery efficiency, and they are preparing the institution to a higher accreditation. Now, they are also putting NABH and JCI in equivalence to working on that. It is not rejecting the previous accreditation or other competitive accreditation, but even working along with that. Or institution which is NABH can also be a JCI. Or institution which is a JCI can also be an ISO. An institution who has already been with NQuest and want to go with NABH can also be an institution, like few public institutions have already taken. So the background that I want to talk about for today's case study for ISO is like this hospital is particularly a 300 bedded corporate uh, entity, a private entity in a metro city. And this hospital is being seen multi-specialty and has majorly services which are offered for its surgical. This is coming from one of my observations that I have seen this hospital for the evaluation part when I went for the NEBH, and then later this hospital I come to know that it is ISO. I tracked down the journey and has seen that this hospital has the all major services. They were known more for their surgical, emergency, onco, diagnostics were very reputedly seen. But for this particular case, I want to say that this hospital, before ISO and they were NABH accredited, they had a very high patient load and a lot of complex clinical cases were coming because the hospital was in the main center area of the city. The ISO certification challenges which the hospital saw was with the variability actually in the clinical processes the hospital was going. For this hospital particularly, it was stated that the documentation was not identified to be completely poor, but some sort of mismatch practices in terms of meeting the regular documentation was not done. Infection control gaps was being seen with specific department, and sometimes cross infections was being as reported. Patients' complaints were with safety, individual, family, and sometimes with respect to the hospital safeguarding incidents. It means like it was pointing towards the employees. Lack of standardization in the quality indicators was also one point that this hospital was pointing towards. And the larger argument for improving or taking the ISO was not just for improving the clinical outcomes, but to see that the top management was very much convinced about taking this ISO as a something which is coming, like the hospital was more in mood of the policy of quality. They were more mood in terms of getting the objectives of ISO, as if like the institutions was much more going towards a approach which was asking them to be more patient focused. The ethical practices from the hospitals were very good. So the hospital leadership and governance was extremely supportive, was a plus point for this hospital. But the processes approaches in terms of the clinical process like high OPD load, IPD transfer was practices were improper, ICU process were handled little poor, support staff, especially laboratory and pharmacy, was not meeting a proper expectation. Billing and HR were something an issue. So the hospital was something working on their standardization. Many of the hospitals who are taking quality is not only just to attract the patient or to just get more benefits, or it is like a it's like a growing fashion. It is more like they are on reducing the variability and they are working on prioritizing the standardization. The risk based thinking was the need that the hospital required here to work on. And as I stated, when you are working on the risk based need or risk based thinking or risk management, you will work on two things. One is like clinical, other is on the operational. Your clinical risk will be something very important which are coming from the medication errors, your prescription errors, your surgical complication, your hospital acquired infection. Your operational parts to take ahead this or to work on this will be like you have to do a lot of preventive practices. I mean to say preventive actions for that part. You have to do a lot of corrective actions which will help you to state that oh, these institutions are something which are more in handling the operational leaks, or they are able to take up a lot of this process part, very important. Okay, when institution is one which is more for this and the institutions are taking this very seriously, the hospitals what will do, the hospital will work on working for the documentation in a proper way. As stated with the start and giving you the entire detailing about ISO's culture, it is more like you are stated to prepare your own policies. You have to work on developing your manual, you means the organization. The organization should have their own SOPs prepared, which are stated by the organization, not to see that what are the things which are going across other, but developing your own standard need to be worked along with what are the lacks in your patient records, how your audits are done, how your incident reporting is done, and on that basis you prepare your standard operating procedure. So here you will find that the culture of traceability and documentation control is very taken by the organization themselves. Okay, not giving to any consultant who is coming for quality and just giving you some sort of an um, reasons that yes, your institution will develop something as a quality, but not giving. So rather relying on that, you rely on your own people who are devoted actually, who have come up with the quality understanding. Okay, the human resource part. the staffing competency, the training part, the credentialing, the continuous medical education was sometimes actually being seen some lack actually as stated, and they started working on this to improve the patient safety part and all that. The hospital took over patient satisfaction survey, feedback mechanism after the discharge, even feedback mechanism in different processes, whether the patient is going for lab and all that. And very importantly, you need to understand is about complaint redressal mechanism. Not only understanding the complaint or take the feedback, even redressal means like administering the complaints, working on the complaints, and giving the benefits on working of that complaints. Okay, means like to mitigate, to solve, to give solutions. Then the monitoring and measurement part. The key performance indicators which were developed and the KPIs, especially infection rates, now to work on reducing the infection rates, to work on reducing the mortality rates of the hospital, which is very, very important monitoring and measurement index. The average length of the stay of the patient should be reduced. That was one principal target taken by this hospital, because the hospital has to work on the ISO certification, and the readmission rate was reduced, which was worked on. So when I'm stating this, and we try to understand that when you have to achieve this, the hospital needs to understand the ISO standards. The hospital should get familiarized themselves with the ISO standards, different processes. The hospital need to work on this, and the hospital achievements will go when in a higher level when they work on the gap analysis. The gap analysis is done through a rigorous process where the hospital will identify the gaps, the areas of improvement, and the hospital will set up an objectives actually which comes up to give the clear goals of the certification. The certification is not achieved only by putting a documentation or a request. It is achieved by improving the patient care. It is achieved by documenting and recording the incidences of giving the patient care, reducing the operational cost and enhancing the data security. So the objectives should be set by the institution that these are all the objectives for coming 6 months. These are the objectives for coming 12 months. These are the objectives for coming 36 months. We saw in the previous case study of JCI that from 12 months journey to 36-month journey, ISO is like it's a continuous process. You don't have to set up a journey that institution has. No doubt the institution will take ahead the history that how the transformation of ISO has taken this hospital in excellence. Okay. So to form a certification team is something like you have to assemble and you need to work on the goals. Like if you are experts who are coming from certain institution and who will observe and they will give you an certification, the certification team needs to have a person who is well versed with the quality aspect, the quality managers, healthcare consultants, medical doctors, IT specialists who has an years of experience working in the institution. So you have to prepare a detailed roadmap. You have to prepare a roadmap which would include the steps from timeliness to accuracy to resources to the certification process. So what is that? Implementation and documentation. Implementation and documentation will give you something as a way to meet the steps what I have stated in a very required way. Required way by whom? By the ISO standards. Like process optimization. So what is process optimization done for ISO? It is like streamlining the hospital operations, aligning with the ISO standard. What is hospital operations according to the ISO standard? It is like you need to focus on patient care, you need to work on patient safety, and you need to work on data management. So process optimization is safely being covered over here. Also, ISO is asking for policy development. So policy development is a drafting the policies, procedure to comply actually with respect to the ISO's requirement, and ensuring clarity and consistency in terms of your work that is done for the ISO. Okay. So process optimization, policy preparation and development. You can say policy preparation and development. Also training. Training is very important. Training, without training, there is no quality. Without training and giving responsibility to the staff, or training for trainers actually, or making trainers also from the institution for the subordinates or working on them, it is not proper. Educate, educate, and educate. These are the three things or three words I can say that your staff have to do, particularly for those people who find that quality can be achieved only by taking a consultancy. Quality can be achieved only by some level of application of accreditation, not ruling out actually the pending issues, not working on the hospital process, not developing your policies, not working on the improvement. So this all demonstrates that a hospital should have an audit. इंस्टीट्यूशन जो क्लिनिकल ऑडिट करता है, इंस्टीट्यूशन जो क्वालिटी ऑडिट करता है, इंस्टीट्यूशन जो डॉक्यूमेंटेशन करता है, institution who come up with the training of audit actually will achieve the certification in a very proper way. Okay. Otherwise, it will take time. There is no such as the improper way of achieving. Internal audit. Now focusing on what is the importance of internal audit with respect to the case I'm discussing, because this will make you more understand what is comprehensive need requirement of ISO. Okay. Conducting regular audit is the key to fulfill the gaps. Okay. Those who are taking notes, I will tell you, just note down that conducting regular audit is a key to all quality successes, not only for ISO, but for ISO, it is very important that conducting regular audits to identify and fulfill the gap. And again, very additional thing for ISO, that is ensuring readiness. Now you have to ready for emergency, you have to ready for floods, you have to ready for famines, you have to ready for wars, you have to ready for all things. If your hospital is on a highway, your hospital is more getting casualties. So if that hospital is working to get a certificate from external agency, you have to even ensure the readiness, and ensuring the readiness is with implementation. Okay. So you have to work on getting these things done. Like all the institutions, this particular hospital was also with developing their key performance indicators. And as I stated, the key performance indicated, what were the key performance indicators they have done? They have prepared working on infection rates. They have worked on mortality rates, average length of stay, and readmission rate. You don't have to do too many things. You have to slowly do. Even in NABH, you don't need to go directly jump and do everything and everywhere. You need to work slowly. Here also KPIs were done. But without developing KPI, it is very difficult for the institution to work on. Okay. And you cannot state that you have to see that KPIs, without KPI you cannot. Preparing KPI, key performance indicator, is very, very important. No doubt your other quality indicators will be there, but what are your key performance? Because key performance indicators are those indicators where you need to work on sharply. And when you know that these are the indicators where you are failing, these are the indicators which will give you more successes. So you need to put it in a very important way that these are the key performance indicators and your institution should work on this this aspect. And these institutions who work and prepare the KPI, they work on developing, they get more continuous success. So continuous success is very important. That is called as Q's quality continuous with the improvement. So your continuous quality improvement is not just in connecting words to make continuous with quality and which will give improvement, but you have to do continuously the stated work which is expected by ISO, and that will give you quality, and that quality will give you improvement in the later phase. And that's how you will complete the quality institution. ISO is called as quality institution, whether it is a hospital, whether it is whoever gets ISO is a quality institution. Okay. To achieve continuous quality improvement, there are three quality tools. Out of the different all tools that we use in quality, I'm not saying these are the only reliable, but these are the very helpful and powerful tools in quality. The three mantras for quality. The very first mantra is the root cause analysis. That is called as going to the root, understanding what are the issues, working on those, making a thorough observation, and fulfilling the gaps. That is called as root cause analysis, RCA. Very important. The second and the best important tool that is worked in quality is called as PDCA. Plan, do, check, and act. When you find failures, you have to do PDCA. When you come up with repeated failures, you work with 1-2 cycles of PDCA. When you want to see a drastic change, you take PDCA as an help. So PDCA is a very important perfect quality improvement tool. And the third and very important mantra is the internal audit, continuous internal audit, relying on your people, making your people more responsible by internal audit. Okay, internal audit are something which has a check markers actually to you. Just like what we find biomarkers, giving you more reasons to be more healthy and more fit. Same like internal audits are essential for hospitals' good health. Hospitals' good health is not only by having a lavish infrastructure. Hospitals' good health is not only having a very trained, very qualified, and highly qualified staff. Hospitals' good health is not only having a good environment around the hospital. No. Hospitals' good health is only by making the people realize about their work continuously and giving them chances to improve. Okay. Internal audits are to improve. And improvement is only the way that hospital can prove their excellence. ISO quality culture is one need that ISO is promoted by developing a culture of safety. ISO is equal to culture of safety. ISO is equal to a culture of quality. So ISO in quality is stated that it is not just an compliance. It is like a culture. Okay. And the core elements of the culture of quality, we are talking about culture of quality. We never use culture of quality in NABH. We never use culture of quality in NPOAS and all that. Never. We use this as more like working on certain standards, certain rules, and 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 working more on those areas where you need to promote. Here the promotion is more towards working on the core element. The very first core element is your customer, your patient. Okay. Second is your evidence-based thinking. Whatever you have to produce a document. You have to have a work. You have to do a quality documentation. You come up with support for that. It is evidence-based thinking. And then only the solution will be made on that. Without anything like will, wish, whims, it will not give you any benefits. Those are all hypocrite thinkings. Evidence-based thinking is something which is giving a strong reasons to give the decision. Again, the quality culture is being stated as quality में staff का involvement होना बहुत जरूरी है. Not only of the people who are selected for quality. Now we prepare quality culture. This quality circles. Sorry, not mixing quality culture with quality circle, but quality circle gives more reasons to bring quality culture in your organization. Okay, so quality circles are more spelled in NQAS, where your staff involvement by selected staff who are interested in quality. But here in ISO, it is stated that every staff should be involved. There is no such as one person is excluded, one person is not willing to wish or is planning to do that. No. So continuous improvement will not be achieved by staff involvement. Your staff involvement is very important. So your hospitals are system-driven hospital. Your hospitals are system-driven hospital because they are working independently and they are not person dependent. By a particular doctor coming, then only this hospital will be a top hospital. By only a certain group of people who are from quality, they will come and they will teach us quality. It is not person dependent. Or by a particular group of nurses coming only will give you quality. No. If your hospital has taken as a system driven approach, as a system driven process, the hospital will create a culture of ISO. So you are expecting a cultural transformation? Yes, it is. You are expecting a cultural transformation. The cultural transformation is a part actually where a hospital is sometimes coming with lot of challenges. Okay. The hospital will come with lot of compliance issues. What are the compliance issues? Navigating your hospital from a very daunting or very zero to hero. Seeking some expert guidance and making a hospital ensuring that the compliance part will be increasing. But in increasing this compliance part towards the and giving lot of regulations, there will be one big deterrent which will be coming. The deterrent is of staff concerns. The hospital staff will be not in mood to change. That is called as resistance to change. And resistance to change is something as a big barrier in quality. Now, most of you must have faced it also. A lot of emphasis by you as a quality manager or a person who are working in quality or in futuristic, you need to emphasize for whatever quality accreditation you are giving, when you are working on resistance to change, you need to emphasize to give them not only training, but to give them a support of what? Gaining the knowledge that if you require, the quality team will always be there. And when you say these words, when you are ready for that help, the people will change. There will be resistance, but you can change them. ISO, it is very important that you have to work on that. Emphasize the benefit of ISO. किसी भी चीज का महत्व अगर हम बताते हैं, उसका एम्फेसिस करते हैं, तो बहुत ज्यादा चेंज होने में हमें सहायता मिलती है उसकी. यू विल गेट बेनिफिट ऑफ दैट. उसका एक बहुत इंपॉर्टेंट रीजन है कि स्टाफ जो है, पुराना स्टाफ है, स्टाफ हु आर परमानेंट, दे डोंट वांट टू चेंज. ओके, दे आर extremely difficult to bring change. But if you are able to change them as an administrator, if you are able to change them as an uh, manager, I think you are the best in quality. So to bring a change is one requirement in quality. You need to think like the Maslow. Na? You need to work on their requirements, and slowly, the people who are not ready to change will also get changed. Okay. I'm saying for this case study, these were the challenges, and these challenges can be met with this. most of the employees in your own tenure, you might have faced a lot of issue with respect to documentation. Missing documents, I'm not talking. उसकी बात नहीं कर रहा हूँ. Misplacing documents, I'm not talking about. I'm talking about documentation errors. Documentation में होने वाली त्रुटियां, गलतियां, ना, robust to robust system are being called best only and only because of proper or best documentation. You cannot say any system robust without proper documentation. Okay, proper documentation or a perfect documentation is called because the documentation, if it is without discrepancies, and the documentation without discrepancies along with audit agar nahi hai, then it's not a perfect documentation. There should be also checkup audits. There should be also fault finders. Okay. This particular hospital was not having issue of cost, but a majority of the hospital who go for ISO certification are facing a lot of cost issues because it is very resource constrained. No, you don't have to put a lot of emphasis on getting the certificate by paying huge amount, but the budget constraints of allocating the resources is very widely as an cost driven activity, because to change according to the requirement of ISO itself is like you have to allocate a huge resource. Okay, you have to explore funding like anything. Okay, your options to get the certificate is like pay the cost of the resources. So you can say, sir, that government institution should go for ISO. I am saying very happy, very readily, the government institution should work on going to ISO. Okay, the cost will be an issue, no doubt. Government will have to pay the cost, or the cost should be taken from the pocket of those employees who are found to be more irresponsible, negligent. Na? Instead of putting some other punishment, the cost of the accreditation should be taken from their pocket. Okay, don't implement this in your situation. I'm just trying to state you this, that this can be a good way like an administrator. Administrators can work with a lot of different things. No? Administrators have a lot of powers. Administrators have a lot of powers of budgets, how to utilize that budget. So I'm saying allocate resources in a very wise way. Huh? Wisely way. I'm saying wisdom, not only like an administrator. Sometimes you can put your budget in a proper way, but wisely is like working on optimal utilization of resources, sustainability of the resources, allocation of resources according to equity aspects, especially for government institution, it is very important. Exploring the funding options also. Sometimes you may have resource constraints, lack of resources, very tight resources. So to cover the certification process or the cost, you need to explore funding options. Funders will be ready if your institution is collaborating with them and your institution is a ISO certified institution. Definitely they will be able to work with your budget part. I'm saying public private mix or public private partnership, or institution who are already corporate, they can get a support of any other support top agencies. Then comes the bigger challenge of time management. This institution also faced the challenge, but the balance of certification efforts and getting the hospital operations or disruptions was not a bigger challenge for this institution. The bigger challenge was of time management in the clinical processes. Okay, but many of the hospitals have overcome those challenges. But what challenge they face in terms of time management? Time management of the balancing the certification efforts with the hospital operations. The certification efforts are asking for much higher, and you are not able to meet the regular daily hospital operations. So what you need to do, you cannot avoid it. You have to work on that part, and you have to manage the resources optimally. Hmm. Now, what are the staffing challenges? HR also challenges has this institution faces a lot of challenges with respect to mid-level employees, doctors, no, not the consultants I'm talking about. So ensuring adequate staffing to maintain the certification process without compromising the patient care is something which is being called by this institution. And this institution has made a very drastic shift. Okay. What they did made, they made a requirement of ISO according to the Infection Prevention Control Committee. The Infection Prevention Control Committee was prepared, and this committee uh, requirement is like Infection Control Committee constituted, people nominated, surveillance system for HAI done regularly, sterilization and disinfection protocols followed, biomedical waste management taken thoroughly, and hand hygiene compliance being monitored. It is not that you need to be only compliant, but even monitoring of that hand hygiene compliance is also very important. Maybe like few additional things if you want, you can add it. But as the institution is developing their own policies, these are the one very important ISO requirements that you need to understand. Now, if the hospital is going for pre-implementation and the internal quality team is working on that part, they need to work on the surveillance. What is the surveillance that they need to do first in the hospital? That is that infection surveillance. Accordingly, you can do prevention and control. Okay. Poor hand hygiene adherence, which was there being seen, is also pre-implementation issue. Inconsistent sterilization process, which is something a fault of a biomedical engineer, a fault of the system, a fault of the people who are monitoring, and a fault of the people who are receiving it, and still they are not able to complain. Like from nurse of the ward to the CSSD, and from CSSD actually to the nurse again and the clinician. In the entire process, if there is no proper coherence or connections or people's mood to improve it, there is a failure, and that will be continued. Now, when we are saying ISO post, what has happened, how this institution has really changed up, how this institution has changed up. The very important part which states that when there was expectation that the staff come up actually with lot of issues with increasing HAI, now with lack of infection surveillance, or some staff is not giving poor hand hygiene uh, training now to the other fellow colleagues. Like I'm talking about the quality team. Quality team have a lot of these issues, or the internal audit actually which is done has shown that your CSSD department is not coming up with proper development. Now, when the hospital has tried and have come up in maintaining over a period of 4 months to 8 months, that majority of the things are taken. The standardization of the infection control practices were met to a larger extent, like more than 70%. Reducing HAI were not to an higher, but 60 to 65% closer they were able to reduce, which was also a very great success. And regular audits were done very regularly, like 100% out of the plan that was achieved. Monitoring, which was a bit challenging part because of resistance and all that, was also taking a good shape. And improve antimicrobial stewardship program. Okay, so improve antimicrobial stewardship program was one reason that an institution has seen success of getting a benefit which was coming out of one a requirement that the patient safety initiatives were covered majorly. Patient safety issues of medication safety, prescription audits, surgical safety, patient identification, fall prevention, incident reporting, proper discharge. So these initiatives which were taken very seriously by ISO certification team, and the improvements were observed in reduction of medication rate, improvement was in patient identification compliance, improvement were in increasing the near miss events and adverse events, and enhanced patient safety culture was also being seen as a key indicator. Okay, and when we talk about this part, very important part is like the the antimicrobial stewardship plan. The antimicrobial stewardship plan, which was giving more benefit to this particular hospital, was coming with the evidence-based interventions. When the antimicrobial stewardship plan was coordinated, the hospital was facing a lot of resistance by the doctors, specialists, that including a specified drug selection or doses or route and administration, we cannot fulfill all these requirements. So without fulfilling this, how come you can improve the patient outcome? Where not you are not able to state a proper name of the medicine, doses of the medicines in a proper capital letter, or you are not able to avoid your favorite medicines. You are putting lot of work on reducing those medicines in your prescriptions who are more toxic. You are avoiding combinations. So this requires a very strong multidisciplinary leadership approach where the team has to go and work and have to make them reasons that it's an accountability that you have to work on improving and tracking your best prescriptions practices, and you have to offer a support of institutional setups which are occupied with a lot of reasons that your institutions are working with the patient's right. The patient has full rights actually to understand what you have written, what this will give you as an complications, what are the multidisciplinary approach, like your pharmacist, your microbiologist, your physician, your nurses. These all people are informed to be very important stakeholders in your antimicrobial stewardship programs. There is a core element of antimicrobial stewardship program which comes of emphasis on education, tracking the reports, and also making that the culture of reporting of all or any incident that happen, you have to work on those. So recommendations should be worked on. The goals will be like you will see in your institution that resistance pathogens, microorganisms will be reduced, or I can say they will be crubbed up. They will be like eradicated. So you have to work on antimicrobial resistance to make more safer and more better on infection rates. So your morbidity will be in control, your mortality will be lessened, and the cost of treatment, particularly for those patients who are with multiple infections, who are with a prolonged hospital stay, who are with non-communicable disease, who are with a lot of medication, self-medication usage, they will get a great benefit. And the cost reduction is the one way you can see the major success of antimicrobial stewardship. As if like you are giving accountability to the healthcare workers to their part that you have to work on minimizing this, okay, minimizing the risk of infection. This requires a leadership support, and this in this particular hospital also, it is as stated in the uh, ISO's culture that it is not a one person driven approach. It is a system driven approach. One single leader is not one who is being taking this. Ideally speaking, in antimicrobial stewardship program, one single leader or a co-leader is also being associated, like a physician supported by pharmacist, a physician supported by nurse, and they will provide a leadership support. They will do some tracking metrics, which is also being spelled up in JCI and even ISO, that lot of your antimicrobial prescribing rates, what you are prescribing, how much you are prescribing, whom you are prescribing, and how much times you are prescribing. All this why, when, who, and where will be asked. And all this will be measured also. What it is called as, this is a global action plan developed by WHO. Okay. And this all your comparison of your practices, suppose how many times you have prescribed paracetamol to a patient, how much amount of paracetamol you have prescribed to a patient, to how many patients you have prescribed paracetamol, and what are the highest doses that you have given of the paracetamol. Can you understand? I have put a what, how many metrics? I have put 4 metrics. Likewise, there might be multiple metrics which can be used to track down the prescribing rates. This I have given an example for non-steroidal anti-inflammatory drug. Antimicrobial, your antibiotics require much a thorough, much a cleared, and a very micro lens actually to deal up with the challenges that we are facing with the resistance of antibiotics. In the coming days, you will find a lot of comparative metrics which will come to state you that whole lot of your patients who are not getting cure is only because they are getting resistance to the antibiotics that you are using rampantly. Your patients are eating, I'm saying eating antibiotics voraciously. Na? So you need to have all these stewardship practices, and this particular hospital has worked on the stewardship practices. The support of the lab is very much required, and the supportive services, and in supportive services, lab is the very first. Second is the pharmacy, and third is the CSSD. I'm not saying these are the only supportive services department which are visible in the hospital, but these are something, the support services which are supporting not only to the hospital but are more supporting to the quality. Okay, quality department is no doubt, or a department is no doubt a clinical department, and non-clinical you count all the support services which are giving more reasons, that lab, pharmacy, and all those are one coming with a very strong support to those institutions which are working and are making more reasons that hospitals will get more benefits because of this. Now, when we are saying clinical audits with evidence-based practices, labs accuracy, and now there is a bigger challenge which most of you might have faced in your own institutions, which comes from the patients. Okay, now the challenge is coming from the patient. The three major challenges this hospital has overcome, okay, might be like these are the pending challenges for many institutions. What is the first challenge? Reducing the waiting time. As if like the waiting time is the biggest indicator of your poor health services. Yes, it is. Your poor health services are determined by the increased or longer or more waiting time. Waiting time for all services. The administrative challenges in quality is reducing the waiting time. Administrators, quality managers, HODs, medical superintendents, COs, CEOs, they need to concentrate on reducing the waiting time of the services. Okay. The second bigger challenge is of efficient patient flow. The patient flow in the hospital is not only derived by the poor management approach, but also by poor infrastructure, by mismanagement of handling the patient flow. Okay. So efficient patient flow is the biggest administrative challenges for quality. So how to handle efficient patient flow? There are ways to do a lot of re-engineering, working on understanding how much a patient load is there and the patient flow should be according to the facility, widening the way actually to make more proper patient flow efficiently from OPD to IPD or even from OPD to referral or from IPD to other higher units. Efficient patient flow is very, very important. And the third and very important is the billing transparency. The billing transparency is the issue which is raised in many of the conversation of the patient with respect to the cost of the treatment, because the out of pocket expenditure is more with respect to the gap in terms of the high increasing price of the medicines, high increasing medical uh, technology, which is putting them this cost, high medical investigations, and the high end technology, which is giving you a lot of issues for the patient of billing transparency. Lot of the faith, lot of the trust issues in healthcare institution is more because of the billing transparency. ISO assessment process in the hospital starts with gap analysis first. I spelled out about the regular steps, but now what this particular hospital has done, along with the regular gap analysis required for the ISO, the hospital has compared the current practices going with ISO stated practices. Like a comparison is done. Acceptable and adjusted and also workable to this particular hospital. Additionally, what they have done, they have identified the deficiencies where we are lacking, where we have a problem, how we need to improve them. See, without working on the deficiencies, you cannot expect an improvement. Excellence is not achieved in one day. Excellence is worked up according to the strategically or persistent improvement in your work. Okay. Then the step two was documentation. The hospital developed a quality manual. Hospital developed their own SOPs, standard operating procedure, and the hospital finally developed their own policy. Now, it is very important when the hospital is developing your own policy for quality, having their own SOP and quality manual, the hospital will sure shot be in the ISO certification. The third is implementation part. Implementation is something which is very important issue to be important for patient compliance, like training the staff. Ultimately, will affect the patient services, process standardization, improving the efficiency in your services, system integration, which is giving you a great and a broader overview of your system. Now, then comes the fourth and important internal audit. Your internal team, how devoted, how dedicated, how workable they are. No? Conducted by trained internal auditors from the team which are identified from a doctor, nurses, administrator, pharmacist. and whole lot of people who are one who will give you non-conformities. Okay. After this, that is a step 5. The step 5 is talking about review performance indicators. Whatever is your performance indicators, you have to review, you have to rework. If there are any problems, it can be solved and magnified actually, and you can work on developing actually those indicators in a proper way or to fulfill the requirements of that indicator. And another working very important is like strategic decisions. Your strategic decisions for the management review is very important at what decisions are taken, what it is to be done for a particular patient, how they are derived, and how they have really helped out. The step 6 was of external audit. Now you are going closer to the certification. Your institution is getting certificate, and this particular institution has achieved the certification by 3 stages. One was they have conducted the certification body survey, and the step 2 was documentation review was done. The entire document that was prepared for ISO, they have done in the step 3 the on-site audit, like going in practical, like going in like an exam, like going in like an external auditor's regular job, and giving them not surprise but to see that you whatever work you are doing is really appreciable, to be improved or to be rejected, and you need to again come back. The certification has a value for 3 years with surveillance audits, which are more being asked to be an coming from an independent evaluation body, which works on effectiveness and compliance. Whenever you see the observable change by the institutions who have taken ISO, the successes are not only because they have got the ISO certificate. No, the institution have prepared themselves for the culture. The very first change that you can see that this particular institution has received uh, ISO will be like you will find the infection rates are reduced, patient safety indicators are improved, standardized treatment protocols are very high. In terms of coordination, they are very good in terms of coordination with one patient to other patient. Especially ANC requires na, in the later phase a lot of coordination between department to fulfill pediatric patient, geriatric patient, na, comorbidity patients. A lot of patients require a lot of other departmental support, and if the coordination between these departments among the employees is done, the patient will result benefit of this. Reduce delay and errors. हो जाते हैं ना कभी. If there are delays, if there are errors, they should be reduced. That is also operational efficiency improvement. And a lot of institutions, like 60 to 70% of them, they literally fail on doing these practices. Improve workflow for an employee. It is very, very important. Improving workflow is something not only for developing yourself, but working more efficiently, working more punctually, working more diligently. The workflow is something which is a derivation of all these things. Then comes patient satisfaction, which is something being called as a key success to getting an ISO. So when you talk about improved communication, you talk about reputation, you talk about better service quality, the patient satisfaction will be high. You don't have to think more on that. You don't have to see that the patient satisfaction is only by fulfilling the feedbacks. It is also working on those feedbacks. It is also working on those grievances. Then only the patient satisfaction will increase. Okay. Organizational benefit. What is the organization that the hospital will get a benefit in? What this particular hospital got a benefit? The hospital got its previous reputation, and even enhanced. It is not that it has got the previous reputation, but enhanced also. Better regulatory compliance, that they were able to meet up and do proper exercises of regulatory requirements, and increase staff accountability. The staff has to be very accountable. If they are able to accountable, they will get the benefit also. They are working in an ISO certified organization. The organization is leading to healthcare quality. The organization leading to patient safety and operational efficiency. What major issue this particular institution have faced with respect to the challenges was that resistance to change. Even in the previous case also we saw that resistance to change was an issue. Documentation burden was something which was very importantly seen as something was coming as an a challenge for all those institutions, but documentation burden was little high, or I can say literally high in ISO institutions. So that is not a one reason of rejection. You cannot reject actually a process which is very complacent, very improving, very developing and evolving. The very important word I would be using were evolving. Now come financial investment. This is the part a hospital has to take care and not an employee. Okay. So financial institution may be a constraint, maybe something like the institution may not like. That may be a reason that this particular institution also was investment in issues were there. Okay. And very important challenge was adapting the industrial standard to healthcare that has come from the global standards. You want to be seeing yourself in the global institutional market. You want to compete with the global requirements. But to adopt the global requirements or global standards, your institution is not ready. Then how come it is possible that this cannot be seen as a challenge? This will be seen as a challenge. Okay. What are the common barriers? Without discussing barriers, how you will be able to achieve the challenges? When you know what are the obstacles, when you know what are the difficulties, suppose you are crossing a road and you want to very safely cross the road. You want to even walk, you want to run, you want to even enjoy the walking. What you will do? You will try to understand what are the barriers over there. One of the barrier may be like there will be a ditch, there will be some sort of an bigger hole. Na? Ideally speaking, there are no bigger holes in the metro cities and this hospital particularly, but there may be sometimes a big work going on, especially of the corporation. Or sometimes you may have there might be some slippery things or some obstacles actually. The common barriers you need to understand, and if you are not understanding the common barriers, you might be very overconfident to beat that, and you will face a big challenge. Okay, sometimes crossing is a challenge. Here in hospital also, lot of resources are making you a lot of challenges. Resource limitation, resource constraints. See, these are two things. Huh? Resource as a limitation, like you have limited resources. Okay. Resource constraints, whatever is there, that also is not proper. Whatever is there, it is not provided proper. Like your gynecologists require a free flow running water in their wash basin tab. Okay. Need to have a proper hand scrubber, alcoholic and scrubber, a soap. This is a minimum and basic resource. But if it is not provided, that constraint will what it will give, it is like a staff will get resistance. The staff will not be ready to say that, oh, we don't want ISO, we don't want NABS, we don't want NQAS. First of all, what we will require is if like we require the basic resources. So you can spell that if we have to do a lot of work in quality. Ideally, I will say first try to meet the basic requirements of the hospital. Second is like the human resource. Third is like working on the maintenance of those resources. And the fourth is very important, the financial investment, which will should be increasing according to the need. There should not be budget constraints, tight budget, this budget, that budget, nothing. Because the successes that this hospital has seen and the successes that you people are expected to see in your institutions after quality implementation is like your leadership at the top is like committed. A very strong leadership will give you a strong benefit. Strong leadership commitment is the key. Staff training and engagement, teamwork, involvement, accountability, responsibility, ownership, all these words you can add to your staff and you give them training, you will find the success. Continuous monitoring by the quality team, continuous monitoring and reporting to the quality management department, quality department, working in align to the three main department as I told you, lab, CSSD, quality, hand in hand. And although otherwise, you may have a lot of integration. You may have a lot of policies in the hospital, but your policies are not integrated with the hospital's workers, procedures, processes. You cannot say the success will be there. ISO 9001 2015 implementation for this particular hospital, tertiary care hospital, was expecting a significant change, though they have achieved it. We saw, we followed that the hospital has seen a very structured, very process driven, and very patient centered approach. Very structured, meeting the ISO requirement, very process driven, whatever according to the ISO has stated, the resources, training, all those, and patient centered system, taking more reasons to work upon according to the patient's need. So ISO 9001 2015 has given this particular hospital and given will be able to meet up the requirement of all the hospitals who are seeking for ISO is like infection prevention, infection control, patient safety, and operational efficiency. Altogether, you can say this is something like a culture of quality towards continuous improvement. Quality cannot be of one day, no? If you require a good quality of an ice cream to eat, is it like you will only get a quality of that particular ice cream as a taste only at one time? You expect that the quality will be seen only when it is being coming to you for the same level of taste what is assured at the proper particular time when you require, and you require the same level to be always and every time, then only you will say it is like a quality of that. It is not that you are making something as an effort to take this, that the Indian hospitals, why they are not going for ISO certification, why they are not working on the real issues, why they are something that these hospitals are are keeping themselves aloof. Again, I'm giving you example of Apollo hospitals over here who have received certification. Just beg a pardon, one minute. Apollo Hospitals Chennai and group of hospitals, they have achieved ISO certification for quality management, that is 9001, environmental management 14001, 22,000 for ISO 22,000 is the marking for food safety. Medical systems, they have achieved it, even for telehealth also. So Apollo Hospital Chennai was among the first hospitals in India to receive ISO certification. Okay. And this hospital has set a benchmark in healthcare quality to be seen that how they have gone with the pre, or I mean to say before ISO certification, that a variation was there in the care delivery system, limited SOPs were there, weakened documentation was also there for this particular hospital, which is very, very common to see, and a lot of case studies are there which can state you that this particular hospital has seen these approaches by improvement. Infection control was made uniform, food safety risks were covered, lack of measurable KPIs were taken, and many private hospitals like this were working. The hospital has also worked over here for a process driven approach rather than a doctor driven approach. The whole lot of this which involves to make a process more fruitful was being seen as a transformative culture. So ISO requires a transformation culture, a system which is mapping the ICU care, a system which is mapping the OT sterilization, a system which is mapping the medication handling, or a dietary services, or a transport services, or an autopsy. All these SOPs need to be prepared. Standard operating procedure need to be prepared according. The quality manager should assure, and the team and the subordinates actually to work on identification of all clinical and administrative processes, and they should create the SOP. See, there are multiple ISO integration from quality to food hygiene. Okay. So you need to ensure that safe dietary services will come with ISO 22,000, ISO 14,001 with waste management, ISO 9001, 2015 for quality systems in hospital. So you need to work on integrating this ISO and work on the standard preparation and making the culture of ISO certification in your institution. Technology integration is very important with respect to EMR and EHR. Hospitals are more to be seen to work upon EMR, electronic medical record. And if your hospital is AI based, they are taking clinical decision making from the AI or support of AI, they will get ISO 13,485 certified. So if your hospital is able to put that your decisions are AI based, then the technology adoption part will give you an excellence to prove your hospital's evidence, and reducing errors which are human driven errors will be reduced. No doubt there might be some errors which are coming from AI also, but we are trying to talk about how to improve the clinical decision making. Staff training and cultural change is also one a benefit. And audit, particularly audit, which is based on accountability. Okay. Internal and external audit plays a major role, especially internal audit, which gives you more chances of improvement, more chances of giving you benefits for putting yourself into the top quality bodies, which give you more reasons that your hospital will be appreciated by the different quality accreditation, will give you more chances to be upholded into the standard clinical pathways. You will give chances to other institutions to become excellence institutions on infection control practices. And furthermore, you can become a global benchmark hospital. na? Like Manipal Group, Apollo Groups in the private corporate, they have become a global benchmark hospitals. And you may find one example of Prince Ali Khan Hospital, Mumbai. It is also ISO certified, and they also have a very traditional system. And now they have worked upon the processes, worked upon the audit trials, worked upon the patient standardization things. Their infection rate was very high, that has reduced, and now the hospital is very well structured. The hospital is transformed, and the base is like a protocol driven. Na? The process are improved. Apollo Telehealth is also ISO 13131, which is one an example of digital healthcare, which has seen telehealthcare quality standards. They have also received ISO. Also, ISO hospitals in India who are working on, they come up with a common scenario. A very common scenario, standardized protocols are not there, poor documentation, and weak infection control practices. These three things, if commonly Indian hospitals are working with the best practices, learning with the best practices, they can get more benefits, because it is very good to learn from others. It is very good to understand your gaps. It is very good to work on developing your SOPs. It is very good to work on having your hospital's own policy of quality, and even developing strong internal audits. The 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 functions of committees are very important, and if you find that a lot of your committees are not working properly, or they are non-functional, they are not doing, then also it is a concern of quality. Then also, in your stage 1 and stage 2, your external committee who is coming to give you certification, this will be identified. Okay. Final outcomes that I want to give you for this particular session and for ISO, that whatever care that you expect for your patient should not be compromised with the standardized expected clinical care. I'm saying expected. Whether it is a private, expectation will be different. Government expected will be different. Evidence-based protocols need to be developed using standardized way of developing your quality of care. Infection prevention, no doubt, is one way, will come from surveillance. Reducing HAIs will be a best way to deal with disinfection and proper sterilization. And patient safety by incident reporting and working on proper patient identification is something which is very, very important. So Indian hospitals, administrators, quality managers, I want to state that whether your hospital is getting ISO or not is not an issue. Whether your hospital is getting and working on NABH is not an issue. But if your hospital is working on quality, it is not that you should be stopped because you are not getting accreditation or you are not working. If your hospital is developing culture of having a biggest impact of working towards quality, you should not stop for a reason that your hospital is pre or post or in the first cycle or second cycle of quality. You should have an informal way of developing a structured team for quality. You should be proactive towards working on the preventive aspects of infection control and patient safety. And individually, your hospital will not work by one person, but it will be worked by the entire system. It's like involvement of all. This is a matrix that I want to put it for Indian hospital, that you should have a culture of quality. Which I'm not saying that yeah, I appreciate ISO. No doubt ISO is the one of the highest appreciating quality standards, and that's the reason I have put this particular hospital to be seen as something as a very important and very exemplary in accreditation, and demonstrating that the culture of quality will be taken with certification, accreditation, no doubt, very important. But if your hospital is more towards patient safety, your hospital is more towards infection control, no one will stop you to get a good quality hospital. No one will stop you to work on getting a standardized na, reputation and accountability. Okay. Along with that, enhance your hospital for documentation. Improve your documentation towards accountability of services. Okay. And at last, stating you that the strong quality culture that you are expecting across the different departments is transforming the institution from one individual person towards an exercise of making a very systematic shift from a very high reliability or high expecting organization from an organization which was previously being seen as a very low or low reliability. I I state that institutions should not only be uh, coming with constraints that these are the internal audit successes or these are performance metric successes or feedback mechanism success. I'm saying a lot of multi-specialty secondary level hospitals who are improving or reducing the waiting times. I've seen quality standards. They have increasing their staff productivity are to be stated as a very good hospitals. And people say that the hospitals staff is very productive. They are very helpful. They are very supportive. The hospital's waiting time is very good. The hospital staff is very compassionate. They are very empathetic. So the patient satisfaction will be directly increased. You don't need to work separately and taking every patient satisfaction score. Nothing. Even though you are trying to take the patient satisfaction score, it will be more for an evidence to put for getting the quality certification. We should not ignore even the rural hospitals requirement also. Rural hospitals are also one who should try to obtain the patient safety protocols, should try to obtain training modules for their staff. They should also work on developing a good working place for the employees, should give more reasons for the employees that they should get more satisfaction. And rural hospitals should not also be ignored because in India we still have lot of load of rural hospitals, rural health settings, whether it is a pediatric load, whether it is an ANC load, whether it is a geriatric load, lot of load rural settings are also handling. So the shift of urban versus rural is also to be maintained with respect to the privacy part, trust part, and hospitals should also work on having a proper documentation, investing on the staff training, and scheduling the regular audits, working on the patient's feedback, monitoring the performances, and overall about the compliance which is coming from the patient. So in the end, I want to give you a great thanks attending all the three live sessions have given me a chance to come back to you and have seen that whatever planning that you have made by attending all these sessions has enhanced my uh, morale, my ethical values towards working into this field and having a passion to give back for the healthcare. No? As a teacher, when it comes to see me, that there is a good response actually that students are working in their own setups actually by completing this course, getting a benefit actually for making reasons to come back and to attain and refresh themselves in the in this. And again, working on their individual areas is very, very um, pleasant surprise, which gives me always every time that I want to get surprised for this, and always need to see that you come up with those. Talking about the question bank preparation and all that, yes, definitely. But I want to say that the same way that you have fill the attempts of the assignments, uh, yeah, the questions will be seen to be as like you have to uh, see that the assignments pattern will be followed, and the same way you have to work upon when you are solving your questions actually. You have to see that way you fulfill this requirement. You can see the documents, your notes. You have to even work on following very logically that the questions will be put some to most level of practical part also. That also you need to work upon. It is not that every question will be of a very theoretical. It can be also practical and very, very logically you can, if you have already completed the entire modules actually properly, all those weekly schedules, and you have completed, you have listened thoroughly, it will be very easy for you to answer this. Okay. So with this, I put an end to today's discussion. Thank you, all of you. Great thank to Amatya, my teaching assistants, student, who have been always there for these modules, helping me. Thanks to the NPTEL team. Thanks to the preparators actually for this. Thank you very much.